Acting Attorney General.
Thank you very much, Mr. Vice President. Mr. Vice President, I beg to move that a bill entitled An Act to Amend the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, the Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, and the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer the 2019 novel coronavirus 2019 nCoV vaccines under the direction and supervision of medical practitioners be now read a second time. Mr. Vice President, as usual, it is indeed a pleasure to be here in the Senate today, contributing and in fact piloting this simple but a very important bill, which has the simple purpose of allowing additional personnel to administer vaccines in the current pandemic that is COVID-19. There was one additional amendment to these provisions put in at the House, the original bill to the House last week, Friday, where we added it to other vaccines as the Minister may by order prescribe. And if I may, Mr. Vice President, members of the Senate, I sincerely doubt that anyone in this Senate thought in 2019, if you can cast your minds back to 2019, that the world would have to deal with a pandemic in the manner that we have been since early 2020. In December 2019, COVID-19 began to spread through the human population. In March 2020, Trinidad and Tobago confirmed its first case of COVID-19. If I recall correctly, it was around March the 12th of 2020. I remember that day being with the Minister of Health at a post-cabinet press conference, talking about it is only a matter of time before this virus reaches our shores, telling persons, we're taking a position, only travel if absolutely necessary and for essential purposes and medical purposes. And literally after leaving post-cabinet press conference, a few moments after, contacted by the medical health personnel who have been serving us so well, to be told it has happened. The first case had arrived on our shores. It was a traveler, a passenger coming back from Europe who had arrived on our shores, had the symptoms. We tested him, meaning the health personnel, and he had registered the first positive case. 12th of March, 2020. The global pandemic, Mr. Vice President, continues. This virus has in a very short period of time negatively affected the globe, the whole globe, and the human inhabitants of this globe. As of yesterday, 15th of November 2021, in Trinidad and Tobago, Mr. Vice President, we had tested 423,692 persons. In fact, I would harbor a guess that some of us in this very chamber have had to undergo PCR tests since March of last year for one reason or another. I myself have had about 4 or 5 of those tests. We have had total positive cases of 62. This is at yesterday. I'm sure these figures will go up today. As of yesterday, we had 62,670 positive cases in Trinidad and Tobago. And unfortunately, the total number of persons in Trinidad and Tobago, Mr. Vice President, who lost their lives associated to COVID-19 as of yesterday was 1,870 souls. I'd like to use this opportunity at this moment to pause and just to offer our sincerest condolences and sympathy to the families of all of those 1,870 persons. In fact, we ourselves, I would be sure to hazard a guess, many of us may have had persons close to us in one form or another who succumb to this awful virus, COVID-19 and the pandemic. Globally, Mr. Vice President, just to put things in context, as of yesterday, over 254 million people, over 254 million people were confirmed with COVID-19, and 5,110,000 people deaths associated with COVID-19 as of yesterday's date. This is a virus that began making its way across the globe in December 2019. So it is less, we're going on to now 2 years old as a virus. And I think people are beginning to become numb. People are beginning to forget that we continue to be in a pandemic and what that means. There can be no doubt, Mr. Vice President, as to the seriousness of this potentially deadly virus that is COVID-19. Trinidad and Tobago, intelligently, in my respectful opinion, from day one, took a decision that in its management of COVID-19, we would follow the WHO decisions, protocols, and guidance. WHO, of course, being the World Health Organization. There are a number of reasons for this and why it just makes complete sense. First of all, as a small island, a small state that we are, to have the benefit of tacking on to all of the expertise, the experience, the scientific data, the analysis, that body that WHO brings is invaluable. And I, as a citizen, have learned that from day one as we began to deal with this pandemic, just by having the benefit of being a member of the WHO and taking that decision as a government to follow religiously the WHO guidance, the WHO protocols. It has served us here in Trinidad and Tobago well all of the time. Quite simply, we don't have the availability of the scientific data, the availability of the scientists, the availability of those doctors with the expertise dealing with this virus and the offsprings of this virus that the WHO has. And that has been the guiding beacon for the government of Trinidad and Tobago and the people of Trinidad and Tobago from day one. Mr. Vice President, the benefits, as I say, are multifaceted. It is scientifically accepted at this stage, Mr. Vice President, that the best current response to COVID-19 is via vaccination. There is no scientific evidence to suggest otherwise. This is what our medical public health experts tell us. This is the WHO guidance. We see the countries that were the first to have the availability of the vaccine and the benefits that that brought as they began to vaccinate their population. Fortunately, Trinidad and Tobago has been able to acquire sufficient WHO-approved COVID-19 vaccines for every single eligible person in Trinidad and Tobago. And let me repeat that. The government of Trinidad and Tobago has been able to acquire WHO-approved vaccines, and we now have a variety of vaccines for every eligible person who can receive a vaccine in Trinidad and Tobago. This has not been an easy journey. I just saw the Minister of Foreign and CARICOM Affairs return to the chamber. He was a key figure and a key component in us being able to achieve this under the leadership of the Honorable Prime Minister, Dr. Rowley. I recall in January of this year when Dr. Rowley took the chair of CARICOM and he began that unenviable task of absolute leadership, not only for Trinidad and Tobago, but for the CARICOM region in acquiring vaccines. This morning at a GECF ministerial meeting, I used the opportunity again in a global energy setting to remind our colleagues all over the world of the difficulties initially us developing countries had in acquiring these vaccines. So we went through that process. The country was on ease, the country was screaming, they were rightfully asking for the acquisition of these vaccines. Fortunately, through a number of measures, we began to have vaccines arrive in Trinidad and Tobago, the WHO-approved vaccines, and began applying them from April of this year. I remember the many late-night calls, the conversations, the huddles, the meetings that took place, the Minister of Health, the Minister of Foreign and CARICOM Affairs, supporting the Prime Minister on medical health personnel, giving us the advice, I having to do some of the conversations on behalf of Trinidad and Tobago, and that leadership that should be applauded today for being able to acquire in a short time, WHO-approved vaccines for a whole population that can get it. And the vaccines began to arrive. By the end of April, going into May, we could see a horizon until June. We knew there would be a small potential drop-off. At the time, the conversation that was taking place in our population was, why don't we have vaccines? Well, we've acquired the vaccines. The next conversation began, why don't you have mass vaccination? Why don't you have drive-through vaccination sites, etc.? Those are all well and good, but you had to have the vaccines in hand to be able to deploy those. And we can now say in the month of November 2021 that the government, through the medical department, the Ministry of Health and its personnel, have been able to do all of those things with our vaccination drive in Trinidad and Tobago. And I want to use this opportunity as a citizen of Trinidad and Tobago, Mr. Vice President, I use this opportunity to sincerely thank all of the medical personnel, or doctors, or nurses, their lab assistants, all of them, for the yeoman's duty and service they have done before the arrival of the first positive case of COVID-19 in Trinidad and Tobago. Again, I was privileged enough to be asked to be part of the committee, leading the charge, making the decisions, advising the government, and seeing firsthand, working along with these medical health personnel. And it has bothered me. It has bothered me as a citizen of Trinidad and Tobago to see the unfair attacks on these public health officers. The unfair attacks, I want it to be put on the Hansard record, the unfair public attacks for the past few months on these medical doctors. Every week I have to meet with them. Every day they provide me and other cabinet ministers with reports as to what our situations are. I have seen the dedication of these medical health personnel. I have seen when the nurses are tired and they don't look after themselves, they just get back into it. I don't know if the population understands that when you have to care for the worst person suffering the worst from COVID-19, how much effort it takes place. Maybe some of us would have seen the international news reports where they allow the cameras into these settings to see persons being put on ventilators, to see them having to be turned. And the solution to all of this, the scientifically proven solution at this stage in the fight against COVID-19 is the approved WHO vaccines. And the vaccines are only as good as when they go into a person's body. And that is what, in a nutshell, this bill is about. As we began to roll out, we could not pull our medical personnel who were there busy, because it's not only the parallel healthcare system where you have dedicated medical personnel, the nurses, the assistants, the doctors who have to provide that care on the wards of the parallel healthcare system, in the ICU unit, which requires a huge amount of medical personnel, and then in the high dependency units. But we are also running on normal medical healthcare system, and persons have throughout this whole pandemic in Trinidad and Tobago been able, you get into a car accident, God forbid, you have a heart attack, a stroke, something else happens, they have all been able to go to the healthcare centers and the hospitals to get the medical care and attention for the normal, outside of the pandemic ailments and emergencies. So again, it is important that we as citizens and we as the members who have been given the privilege to serve Trinidad and Tobago in this House, in this Senate, sincerely thank all of those who have contributed to both our healthcare system, the normal one, and the parallel healthcare system. And I sincerely thank them today. So what we discovered is, as we began to roll out our vaccination program, really from about April, May, June of this year, and as the numbers of available vaccines became available, and now we've crossed over 600,000 persons being fully vaccinated, you require people to administer the vaccines, and you require people who have the skills and the wherewithal to deliver these vaccines. Of course, the legislation at the time only allowed certain persons to deliver the vaccines. So what we did under the state of emergency regulations, which came into play in May of this year, is we broadened, at the request of the Medical Health Department, that is the Ministry of Health, we broadened the availability of persons who could deliver these vaccines. And that is what we're about here today, because as we know, tomorrow we will go to the House, we will revoke the state of emergency, and by revoking the state of emergency, so go the state of emergency regulations. So we are taking the opportunity now at this stage to put into the parent pieces of various legislation the ability for certain persons who are trained in medical care and attention to be able to deliver vaccines, not only in this current instance of delivering COVID-19 vaccines, but also any other vaccine as a minister may by order prescribe. Because one thing we should have learned from this pandemic is you never know what is coming around the corner. We don't know when next we will need to have a mass vaccination drive. And let us not let the legislation hold us back. So we're taking in front now, using the opportunity. And this bill before us here today, Mr. Vice President, is going to be by Clause 2 to allow emergency ambulance personnel, medical technicians, paramedics as we call them, to be able to deliver the COVID-19 vaccine and any other or such other vaccine as the minister, which is the Minister of Health, may by order prescribe. That's the first category of persons that we're dealing with today, or paramedics under the Emergency Ambulance Services and Emergency Medical Personnel Act, or emergency medical technicians. We're giving them that ability once the Minister of Health orders that they can administer in the first instance the COVID-19 vaccine. We're then under the Pharmacy Board Act, this is Clause 3, we're allowing pharmacists acting under the direction or supervision of a medical practitioner to administer the COVID-19 vaccine, or, as we're saying, any other vaccine as the minister may by order prescribe. One of my colleagues from the independent bench asked me, does this legislation allow persons now to administer vaccines anywhere? And what if they have an adverse reaction, the person who's receiving, the recipient of the vaccine? So for example, in a pharmacy, are we going to have the requisite medical care and attention for that? The parent legislation doesn't deal with that. Those are administrative decisions. The parent legislation is to make it legal for these specifically, expressly identified categories of persons that I'm going through to have the power in law to administer the vaccine, however, under the direction or supervision of a medical practitioner. As we've seen throughout the administration of over 600, I think we've crossed over 1 million jabs in arms, vaccines in arms, to cross that 600,000 fully vaccinated persons. We've seen that we have set up in all of these areas administratively the requisite observation and then necessary first treatment areas. So that would not fall into the parent legislation. The next category of people we're capturing are nursing personnel. Nursing Personnel Act, we're amending it to allow nursing personnel, again acting under the direction or supervision of a medical practitioner, to administer this COVID-19 vaccine, or such other vaccine as the minister may prescribe. The next category we're dealing with under Clause 5 is the Dental Profession Act. So we're allowing those who are registered to practice dentistry to acting under the direction or supervision of a medical practitioner to administer the vaccine. We're also at Clause 6 allowing veterinary surgeons under the Veterinary Surgeons Registration Act to administer these vaccines. And the last category of persons that we're dealing with at Clause 7 is professions related to Medicine Act. And we're specifically identifying, by amending that act, medical laboratory technician or radiographer. We saw the need for all of these additional categories, Mr. Vice President, during the heart of our vaccination program and when we had thousands of people being vaccinated a day. It would be remiss of me at this stage not to use the opportunity through this Honorable Senate and all of the members here to make a personal plea once again to those who are eligible for vaccines, please utilize the opportunity to have administered to your good self the WHO-approved vaccines that we've managed to procure for you. Because at this stage, the science shows that it is very possible that it will save your life. In fact, when you look at those who are in our ICU wards and our ICU beds, it is 94% of them that are unvaccinated. This now sounds like a record, and a stuck record, but it is the God-honest truth. So the plea is all of the persons who are yet to be vaccinated, who are eligible to be vaccinated, please use the opportunity to have those vaccines administered to your good self, because the benefits are undeniable and scientifically proven. And in a nutshell, Mr. Vice President, that is what this bill is here about. This bill here today is about. And I ask that all members of the Senate give it due consideration and support this, because we don't know what will happen next. And what it does now is it amends the parent legislation of those 7 categories of persons to allow them the legal ability to administer vaccines now for COVID-19 and in the future as the minister may order. Thank you, Mr. Vice President.
The magic words,
I beg to move.
I'll now propose a question for debate. The question is that a bill entitled An Act to Amend the Emergency Ambulance Services Emergency Medical Personnel Act, Chapter 2902, Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus vaccines under the direction and supervision of medical practitioners be now read a second time. Senator Gopi Singh.
Thank you very much, Mr. Vice President. I consider it a privilege to be able to be here this afternoon in this distinguished chamber and to respond to the Honorable Attorney General on this important piece of legislation, the Miscellaneous Provisions 2019 Novel Coronavirus Vaccination Personnel. And this bill seeks to amend, as you said just a while ago, Mr. Vice President, the Emergency Ambulance Services and Emergency Medical Personnel, which is Chapter 2902, to amend the Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 6704, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professionals Related to Medicine Act, Chapter 9004, to authorize additional personnel, that's the important aspect, to administer the 2019 novel coronavirus vaccines under the direction or supervision of medical practitioners. So on that, the important thing is you're seeking to authorize additional personnel by this bill by amending a number of pieces of legislation, about 7, to help to provide more personnel for, of course, an important function, which is a must to enable and facilitate mass vaccination programs throughout Trinidad and Tobago, so we can move swiftly to herd immunity, which is now considered not to be 70 or 75%, but to be about 80%. And then we still have to deal with this issue that some patients, some vaccinated people, even with 2 vaccines, having some difficulty, which is about 5% of those who had 2 vaccines. Now, we support this issue of having additional personnel, definitely, because we support the whole question of ensuring that this country, we reduce the amount of citizens who develop major complications, end up in ICU, and pass away, unfortunately. My understanding, Mr. Deputy Speaker, these amendments are in anticipation of the expiration of the period of emergency, and I heard the Honorable Attorney General, Acting Attorney General, say tomorrow. Presently, the Emergency Powers 2019 regulations and Emergency Powers Coronavirus Amendment regulations made provisions for medical and other medical-related personnel to administer vaccines over the last few months. And these powers were granted under emergency power regulations and therefore would only last for the remaining period of today and possibly tomorrow. Now, let us examine the question of the necessity for additional personnel. I don't think the Honorable Attorney General would have been able to put together the information on how many personnel we really need in the country to administer mass vaccination programs. I think this is one area that in bringing this bill, the government should have been able to provide some degree of empirical data to make a case, obviously, for your additional personnel, and so it would have a much more meaningful aspect towards the legislation which you're proposing. We know that there are 105 health centers in Trinidad and Tobago, and if you have to have a direction or supervision of medical practitioners, it means then that we may have to have medical practitioners for these 105 health centers on a daily basis. So if you're having nursing personnel giving vaccines, you must have a medical practitioner. Now, does that mean a medical practitioner, or when you speak about supervision or direction, what does that mean? Does it mean the supervision is from outside? And the direction, what do you mean by direction? That is ambiguous, it is vague, and that needs some clarification. You can't come and say it is direction or supervision. Does it mean that the medical practitioner must be on site? And I will want to expand on that a little more later on. So, but who is a medical practitioner, Mr. Deputy, Mr. Vice President? Under the Medical Board Act, a medical practitioner is defined as a medical doctor who is registered under the medical register. Now, when you're an intern, you get temporary registration. And when, after temporary registration, you go to full registration. So a doctor, we have about 3 medical practitioners here in the Parliament, and they will obviously understand what it is I am bringing out. A medical practitioner to supervise can be one who just finished internship, so with little or no experience in the world of work in medicine. So just you have your 5 years training, 1 year internship, and then you come out and you register under the registration of the medical board. Now, is that enough experience to supervise areas across Trinidad and Tobago where a medical practitioner just finishing internship has to supervise all of this? I want to prefer that you put a time frame for the experience of the medical practitioner into consideration on this matter. I believe a doctor practicing for 2 to 3 years will be an adequate person with enough clinical experience to deal with the supervision of all these personnel throughout the country. So I want to ask the Honorable Attorney General to consider making an amendment to the question of, under the direction and supervision of medical practitioners with a certain amount of clinical experience, whether 2 years or 3 years or 5 years experience. The other issues, Mr. Vice President, I was making a point about how many additional personnel we need. We have drive-in sites with a number of centers. We have fixed sites like UTT, Napa, SAPA, the stadium, Queen's Park, Savannah. And then there are multiple sites in those areas. You might have 15 cubicles, one area, and so on, 30. But they would have the information of how many they used in the past. And that information, I hope, when the person responds to me, they will probably be able to give some information on these amount of personnel in these areas that they have been using. And are the personnel working on a shift system? They start at 8 in the morning, 9 in the morning. They go to 5, 6 o'clock in the evening. That's probably 9 hours sometimes. Do they change personnel after a certain amount of period of time? Now, this is mental work where you have to be on your P's and Q's at all time. So how many personnel needed at each time is critically important, and the categories of personnel required in those sites. So therefore, the total needed on a daily basis. Then the other question, has the government indicated whether these personnel are being paid or they're volunteers? Now, and how much they are really paid, that hasn't been forthcoming. I know there are a number of private organizations which said that they were doing volunteer work. They might have paid the personnel, and these are large corporations and so on. But is the government paying them? I understand that the government employed a number of people. They were promised about 500 a day or so, and I think they fell short of their promise, and they began to pay about 300 per person who was involved in this. I stand corrected. They should tell the country what is really happening. Now, if you have to pay for personnel, I believe that you should pay for a significant amount of medical personnel to be on the site as well, because they are critically important and will alleviate the fears, anxieties of a lot of people, which are now very evident, which will be answered when they know that these sites have personnel to deal with, God forbid, any emergency matters. So, Mr. Vice President, Chapter 2902, the Emergency Ambulance Service and Emergency Medical Personnel Act, is amended. For the purpose of this section, novel coronavirus means a COVID-19 vaccine approved by the minister with responsibility for health on the recommendation of the Drug Advisory Committee in accordance with paragraph 7, Division 3 of the second schedule of the Food and Drug Regulation. I had been a chairman of a regional health authority in 97 to 99, and then for 2 regional health authorities in 99 to 2000. And we had Central Drug Advisory Committee and a Drug Advisory Committee. I would have felt happier if the Minister of Health would have told us how functional that Drug Advisory Committee is, what is the composition of the Drug Advisory Committee, because they have to make decisions on a number of things related to the pharmaceuticals that are being used for the management. So I would look for a response as far as the Drug Advisory Committee is concerned. Probably you can get some information for that. My colleague on the other side, the Minister of Foreign Affairs, will have quite a lot of information on that. So we want to know how is that functioning to give some support and advice. Then the Pharmacy Board Act. The Pharmacy Board, well, we want pharmacists to be able to give vaccines. Where they're going to give the vaccines? Is it on the sites where the vaccinations are being given, Or are they going to start giving vaccine in pharmacies? Because this is ambiguous as far as that is concerned. In other words, the bill says pharmacists can give the vaccine. They're seeking to get permission for the pharmacists to give the vaccine. So the issue on the pharmacy and the pharmacist has to be answered. I will speak about the training and requirements and so on in a while. Now, the other area is the other bill, the other Medical Personnel Act, Chapter 2902, to authorize emergency medical technicians, paramedic, registered. Now, we know the emergency medical technicians in Trinidad, basically from a company that is running the emergency system, whether it is 40 ambulances or 49. How well trained are they? Are they basic trained? Are they intermediate? Or are they advanced trained? And whether they are paramedics registered under this, they have to be registered. But my understanding, and I'm sure my colleagues will tell you, that the level of training of the paramedics in Trinidad and Tobago need to be lifted a lot more at the moment. There was legislation on that, but I don't think we have evolved from one level to another very easily. I know internationally you have those capable of giving, with a heart attack, the shock therapy to bring the heart back into the system. We know that there are systems where you could give intravenous drugs in the ambulance that can save the life. But I'm not certain as to where we are in Trinidad at the moment in terms of the emergency medical technician. So who are you giving this power to? The paramedic? And then you have a step advanced to that. But you haven't introduced the person beyond the paramedic. Why have you stopped at the paramedic? There are 3 steps before that paramedic. So this needs to be answered as well. Now, nursing personnel, Mr. Deputy Speaker, the people who have been involved, the personnel, have done tremendous service to this country. And we congratulate them and thank them sincerely for all the tremendous amount of work and dedication to help saving lives. I listened, unfortunately, on Saturday when the Honorable Prime Minister indicated that our leader of the opposition has been blaming the medical personnel. And I heard the Attorney General this evening speak about it as well. The opposition leader and no member of the United National Congress has ever blamed the medical personnel or any personnel delivering health care to the people of this country. We have always praised them. We have always congratulated them. But you know who we blame? We blame the Prime Minister. We blame the Minister of Health. And we blame some of the personnel, the medical, who are giving advice to the Prime Minister and his team. They're falling short of the advice which is required, and this is why we try to pull them up, Mr. Deputy Speaker, Mr. Vice President. We have been asking to give us the mortality rate in the ICU for almost 4 to 5 months now. They have absolutely refused to provide any information. Why? Why are they hiding that? Because the mortality is close to about 100%, when developed countries have a mortality rate of about 30%, 40% in an ICU. So this is why we have to be searching for information, and the advisors to the Prime Minister and his team have failed and are continuing to fail to do what is required. Provide the information and the statistics in terms of the mortality rate in the ICU and the HDU. Mr. Deputy Speaker, the next point is the
46.1. We're not talking about ICU and mortality.
We need to inject that right now.
Mr. Deputy Speaker, I took copious notes when the last...
Senator Gopi Singh, I understand that, but I'm sure you're moving on now from what I've heard, so just move on.
I wonder whether my colleague was on the other side was sleeping. He must have had a long night. And I have it right here, Mr. Deputy Speaker. The Attorney General was speaking about the ICU, and the ICU unit requiring a huge amount of nursing personnel. I documented it. So when I speak about the ICU, that's in a relevant state, and I'm moving on. The nursing came to the fact that the nursing aspect, the Nursing Personnel Act, Chapter 2953, to authorize nursing personnel to administer the vaccine under the direction and supervision of a medical practitioner. We have some of the most brilliant nurses in Trinidad and Tobago, some of the best in the world that they are sought after internationally. Here, a nurse will make about $2,000 US a month, and 24,000 US a year. They go abroad to Canada and the United States, right next door in Miami, they make about 90,000 to 100,000 US a year. So we thank the nurses who stay here. We thank them for giving their service. But I just want to ask one question here. When you say nursing personnel, how far you reach? We have nursing supervisors, we have top nurses, we have state-registered nurses. But under the Act, it also mentions a nursing assistant. Are we including nursing assistants in this? I hope my colleagues are taking note to answer that question. To bring in dentists and dental interns for vaccination, good. In fact, dentists use the smallest needles and the most delicate spots in oral cavity and so on. So they are well equipped in knowing about vaccines and how to administer vaccines. The dental interns, I'm sure during the training program, they would have been able to understand and appreciate how to give the vaccine. The vets, small animals, the vets give injections to small animals very easily. So we have no question about the vets being able to provide the necessary treatment and the necessary injections. Now, I have a little problem in this aspect, which is Clause 7 of the bill, which seeks to amend the provision, Professions Related to Medicine Act, Chapter 9004, and to authorize medical laboratory technicians and radiographers to administer vaccine under direction and supervision of a medical practitioner. Now, we have some of the best, very qualified, very capable, very competent medical lab technicians and radiographers. They stand second to none. So the issue here is they have not been through the training program in these two areas of giving injections, whether intramuscularly or intravenously. So how is it now that we are including them under direction and supervision of a doctor, of a medical practitioner? So the medical practitioner might be far away from the site. So is there a necessity to bring these personnel in for vaccinations? Because the bill says to administer vaccines, Mr. Vice President, so they will be administering vaccines. So we have difficulties in understanding and appreciating this aspect. Mr. Vice President, I want to prefer now that the legislation is vague and uncertain with regards to who can lawfully administer a COVID-19 vaccine in a couple of instances which I have been through prior to this. And under Section 41.5, the interim counsel shall, within 1 month of being appointed, I'm talking about the emergency medical technicians, commence registration of all persons who hold qualifications as emergency medical technician, basic, emergency medical technician, intermediate, emergency technician, paramedic, and emergency medical technician instructor, which is the highest level. So the question must be asked, if we are authorizing the emergency medical technician at the level of the paramedic, Are we to assume that the emergency medical technician at the level of instructor is also allowed these privileges? The law should be clear and unambiguous. How can it be that a person that has a higher level of qualification, as deemed by the Council of Emergency Medical Personnel Board, not know if he or she can have these expanded functions? Now, the question of where are these people going to give the vaccines? It would have been helpful if we had an indication of where this additional scope of functions would be legitimate, that is the administration of the vaccine. Is it that an emergency medical technician will be able to dispense vaccine at a private medical office, doctor's office, or practice? Well, the obvious aim of this bill is to allow an expansion of the vaccination drive at the Ministry of Health's clinic. So specify the sites, specify where they can give the vaccines. But can an emergency medical technician now come in at a private doctor's office and be paid to administer vaccines when you give them that legal ability? Is it that a pharmacist will eventually be able to dispense vaccines at their pharmacies, as is done in the United States and Canada, which have a different training system for their pharmacists? Will vaccines be eventually allowed to be dispensed at our nation's pharmacies? Now, how long, the issue is when then, Mr. Deputy Speaker, how long would this additional scope of function be for? What is the duration? Is it for infinity? I think there should be a time frame indicated in this piece of legislation to give an appreciation at least a year from now, because the pandemic is going to go on for another year. And this is not clear, and we want to advise that that aspect of it, a time frame, be introduced into this piece of legislation, thus allowing it to be renewed, whether you have a sunset clause after a year, or you go on and you come back to Parliament, and I'll speak about that in a while. But while I'm in that, before time runs out, there is a certain aspect of this piece of legislation which calls upon these vaccinators to be able to give other vaccines. And it is broad and vague. Which other vaccines are they being allowed to give? What vaccines are required in the future? You cannot have a piece of legislation that gives autonomy to people who are supposed to be trained on vaccinators to give other vaccines. What vaccines? Measles, mumps, rubella, tetanus, chickenpox. What vaccines? Or the influenza vaccine? We have no difficulty now with the administration of influenza vaccines. You get it at the health centers. You get it by general practitioners. So there's no problem. If you want to have, you don't have to bring in the influenza vaccine in this issue here, because it is already happening. So which vaccines? And then they have, Mr. Deputy Speaker, it may by order, the minister may by order. And so he can just order that these vaccines must be given by these people, emergency technicians and pharmacists and so on. By order, this piece of legislation, Attorney General, needs by affirmative resolution of Parliament, not negative resolution, so that when this has to be, this is a thing that touches people's lives, you know. A vaccine is a life, you know. And let me make it clear. I want to say that from my perspective and the perspective of the opposition, we can't find any relative contraindication to the use of, to the administration and the acceptance of the vaccine, and we recommend it fully to every citizen of Trinidad and Tobago. We have been saying that from the beginning. Our 3 doctors in the other place have recommended it. The Prime Minister spoke about me, saying that he is happy that Dr. Gopi Singh recommended the Sinopharm vaccine. And some of my colleagues have videos and so on, strongly recommending the acceptance of the vaccine. So we preach to those outside, please go and take your vaccine or you'll end up in difficulty and in trouble where you look to God and you cannot be saved. And there are many families where 2, 3 members of those families have passed away because they have not taken the vaccine. there's no relative contraindication to taking it. Everybody should go and get it, whether you have cancer, whether you have an immunosuppressive disorder, whether you have diabetes, hypertension, and particularly obese people must go and take the vaccine because there's an association between this virus and the patients who are obese. Very strong association. Now, the issue of vicarious liability, Mr. Vice President, this brings me to this point. It's a situation in which one party is held partly responsible for the unlawful actions of a third party. The third party also carries their own share of the liability. Vicarious liability, as we have some very brilliant attorneys in the House, and today another attorney was sworn in. Vicarious liability can arise in situations where one party is supposed to be responsible for and have control over a third party and is negligent in carrying out that responsibility and exercising that control. And the Trinidad Newsday on 29 September 2021 reported a 34-year-old woman saying that she was given the incorrect COVID-19 vaccine when she returned to the Chaguaramas heliport vaccination site for a second dose in August 2021. The first dose she was given was AstraZeneca, but when she went back, she was mistakenly given Sinopharm. That's a court action, I believe, being done now in the courts. And those distinguished attorneys, you all know about the Salmon test. Sir John Salmon has been commonly used by the courts, and the Bolam test. And I'm sure the Attorney General know about these, having been in the court system for a long while. And where a particular skill or professional expertise involved, the appropriate comparison is with a person with a small skill or expertise. In fact, in the United States, the PrEP Act coverage provides liability, and I want to read from this piece of research, subject to certain requirements and if eligible, PrEP Act coverage provides liability protections under federal law and state territorial law with respect to all claims for loss resulting from the administration or use of a covered countermeasure, in the case COVID-19 vaccine. So everyone has been reading about the PrEP Act. So, Mr. Vice President, this has to be addressed, the liability aspect. I know when we were younger doctors in the hospital system, and God forbid anything happened, we were covered by the state legally. But with these vaccination areas now, with the different personnel, who is covering them and under what area? Mr. Vice President, would you be kind enough to indicate how much time I have left?
You end at 5:53.
10 more minutes.
5:53, yeah.
Thank you. 5:53. So the malpractice insurance is an important thing. So what about the pharmacists, the vet surgeons, the professions related to medicine? Are they going to be liable personally should an incident that can be deemed malpractice occur? Or is the supervising medical doctor malpractice insurance liable? And we would appreciate if the Attorney General could please clarify. Should a child develop myocarditis, which is an inflammation of the cardiac muscle, or an elderly patient with comorbidities develop a severe thrombus with thrombocytopenia, I want to tell the population these are rare events, so don't believe that these are occurring. But in case it happens at any time, from a vaccine dispersed by someone in these additional categories with expanded function, would the vaccine manufacturer deem this incident as a vaccine being dispensed by an authorized person? Mr. Deputy Speaker, the reason I ask is because when we inquire about the terms and conditions of the vaccine manufacturers with our country, we are simply told non-disclosure agreement. It is something that we have to consider because we are expanding the categories of professions that can dispense these vaccines, some without significant clinical training. So these are the side effects. You have side effects like Guillain-Barré syndrome being reported. That's a ascending neuritis, where you get weakness in the leg coming up. Sometimes people get difficulty in breathing, and they inhale problems. So an increased number of children in the underage group with having a few problems now and then. So many of these vaccine manufacturers have written detailed exemptions from liability in their non-disclosure agreements. So are we leaving our citizens without a legal recourse if some of these professions were not named in the non-disclosure documents or agreement? Mr. Vice President, there are a lot of issues expanding the COVID-19 vaccination workforce, use of PrEP Act authorities to protect your community, but most healthcare personnel are needed to administer these life-saving vaccines. To address this need, the Acting Secretary of Health and Human Services in the United States and Britain and so on has signed an amendment to the Public Readiness and Emergency Preparedness Act Declaration, PrEP, that expands the pool of qualified people who can become vaccinators. The definition of covered qualified persons authorized to give the vaccine has been expanded as is being sought now. But the issue of training, Mr. Deputy Speaker, I am a little worried and very concerned about the issues of training when you're bringing all these additional support, which is required, but they have to be trained. And its importance of training healthcare personnel. A large number of healthcare professionals are needed to support COVID-19 vaccination efforts nationwide. We know that. These healthcare professionals are essential to the population, and when vaccination safety is critically important. They play critical roles in proper vaccination storage. That's an area of training. Handling, preparation and administration of the vaccine. And they must be prepared to respond to vaccine recipients' questions and concerns. It is important these healthcare professionals receive the training needed to effectively meet the demands of their roles. The government must speak about what training programs they have. I heard something in the other place the other day where the Minister of Health was saying something, but it wasn't clear. They had 400 and something people trained, whether they one-off training for 2 hours or 3 hours. It's continuous training. That you're dealing with people's lives. So if you bring these people on board, they have to be fully trained to become a vaccinator. Training must be ongoing as new COVID-19 vaccines become available and as vaccine recommendations evolve, where we learn more about the vaccines and how to improve the vaccination process. Medical support staff, critically important, with vaccine preparation and cold chain management. Administrative support staff can assist with cold chain management, data reporting and distribution of required materials to vaccine recipients. Training is important not only for those who will prepare and administer vaccine, but also for those responsible for other critical mandatory functions, including protecting the vaccine cold chain, inputted required data, and ensuring vaccine recipients receive documentation of vaccination. It's a mammoth task, but we must not fall short. The competency is important, Mr. Deputy Speaker. Vaccine manufacturers have a number of training programs internationally, CDC, other federal entities, public health agencies, and professional organizations provide a variety of training resources, including print materials, training modules, webinars, seminars, and videos. For healthcare professionals who will be preparing and administering vaccine, it is essential that training programs also include an observation component and competency assessment. There are sections which describe training and competencies. So core competencies, clinical considerations are important. Storage and handling requirements, preparation requirements, administration requirements, anaphylaxis guidance, Mr. Vice President. Anaphylaxis guidance, you never know when that can happen. Don't tell me that an emergency medical technician with a basic level can deal with it. So you need to continue to train and train. I'm not comfortable where I stand from now as a doctor for 47 years. I am a little uncomfortable with the level of training that I heard that has been given at the University of the West Indies and also by 2 or 3 other people over a short period of time. So it's a continuous process. And you see training being spoken about in the American literature, in the British literature, requirements for joining the expanded COVID-19 vaccine workforce, current certificate in basic cardiopulmonary resuscitation. That's a USA trainee. So if you can't know how to resuscitate a patient, you find yourself in difficulty, and to bring you in on the program of giving vaccinations, it's not a good thing. Vaccine storage and handling, vaccine administration, and clinical considerations, Pfizer vaccine material, Johnson vaccine material. So, and then the qualifications for people who need to be vaccinators. So, Mr. Vice President, the British system, you have the government of the United Kingdom, they have training recommendations for COVID-19 vaccinators. The importance of training for COVID-19 vaccinators. Who needs to be trained? Training requirements for training provision, supervision and assessment of competency, additional training, remaining up to date, and so on. So in summary, from that aspect, with an ongoing pandemic that continues to cause millions of infections and over 4 million deaths across the world, it is crucial that COVID-19 vaccines are safely and effectively delivered to as many of those eligible as possible. This will require knowledgeable, confident, and competent vaccinators. It is therefore vital that anyone administering the vaccine is given the time and opportunity to undertake the comprehensive training and ongoing updating their need, and that they are supervised and supported in practice as required. Mr. Deputy Speaker, we need more vaccinators, but they need more training. They need very specific training, they need competencies, they need certification, and you need to do an analysis as a government of how many you really need. Can you pay more doctors? Can you pay more nurses who are top-line people to do the vaccination, rather than risking the other areas where these people pay them properly? If you spend $5 billion on healthcare, on the COVID-19, you see, we spent $5 billion. How much have you paid these personnel, doctors and nurses? So look to see where you can get more competence, rather than diluting the area and creating problems at the vaccination centers. We urge all citizens to be vaccinated. Thank you very much, Mr. Deputy Speaker.
Senator Dayal Singh.
Thank you, Mr. Vice President, for allowing me to partake in this very important bill we have this afternoon. So I must say the pandemic has been a nightmare, a doctor's nightmare. Just to handle this pandemic, to see the fallout, it has been a nightmare to myself as a doctor, also as a parent. You know, we are worried about our children, and even as a child to my father, it's a nightmare to know if he will succumb also. So never did I expect in this lifetime I would have been seeing a pandemic occur. And I understand it's just not a nightmare for myself, it's a nightmare for citizens at large, and it's a nightmare also for the government to have to handle this pandemic, because I don't think when most of the present ministers entered government, they would have realized they would have been facing this challenge, not just an economic challenge, the medical challenge, but a global challenge. So it is definitely a challenge. And with times like this, like these, we have to come forth with certain suggestions. We have to come forth with certain ideas that can help us. And having this bill here actually it's really a need that came about, not just in Trinidad, but globally, a need to see how are we going to get other personnel to come on board to help with this war with the invisible enemy. So when you had this invisible enemy, you had to bring forth all our citizens who could come forward. Medical personnel out there who were getting fatigued, tired, burnt out. So we had no choice but to bring in other persons. And this is what they did, not just here, but elsewhere. So while I look at the miscellaneous provisions, 2019 Novel Coronavirus Vaccination Personnel Act, which seeks to amend the Emergency Ambulance Services Emergency Medical Personnel Act, the Pharmacy Board Act, Nursing Personnel Act, Dental Professions Act, Veterinary Surgeons Act, and the Professionals Related to Medicine Act. All these serve to bring in these other soldiers, I want to put them, to fight in this war. And we are here today because the emergency powers that we had under the state of emergency is ended. So we cannot rely on that again. Now we have to go, there's two choices we have. We have either we extend the state of emergency, or we now seek to amend these pieces of legislation to give us the power to have these soldiers on board to help in our fight. You see, we tend to have a sense of helplessness where we don't have any answers to children, to patients. And right now, that sense of helplessness, we all feel good in trying to put things in place to help the vaccination drive. And persons who came out, the personnel who came out, who volunteered their service, it's a psychological function where persons feel that if there is a common enemy, a common threat, they can come together, bind together to save. So it's something we saw, as a psychological need, that people came out and answered that call. And a lot of people came out, and some of them came, they wanted, some of them couldn't volunteer, some of them volunteered in other ways besides the vaccination. Some of them volunteered to try and get the manning of the stations better. There were hiccups, as mentioned by the first speaker, where he mentioned hiccups occurred with the rollout. Remember, we had a delay in the rollout. We had problems with, even getting the supply. We had conflict with Barbados. We had problems with the Indian High Commissioner, certain statements, and it was settled, thankfully, by our Minister of Foreign Affairs, who used diplomacy and calmed those waters. But again, we now have a slew of vaccines available. So we have no problems with vaccine. We're in a good place with that. We also had challenges with the long lines, waiting in the rain. We saw all these things. But thankfully, again, we have now ironed out that situation, and we have a system in place. So we have vaccines. We have vaccinators, and we are hoping to hold on to our set of vaccinators. And we still have a challenge to get the vaccinees to come forth, those hesitant individuals out there who some may have valid fears and may not want to come forth. So what I might say is the Prime Minister and his Minister of Health, they were pleading, they were scolding. Sometimes the Minister of Health shed a tear, but they were trying all how to make people obey the public health regulations. And trying to obey, I think it's something, it's just to convince people, to motivate people. So they were fighting against the onslaught of public having a distrust. And, early o'clock, I had called for the mandatory wearing of masks, and I also called for fines for social distancing, Mr. Vice President. And I think even after the lockdown has ended, the SU has ended, we may have to, if we see the populace acting in a manner that is not responsible and could be somehow harmful to those others who are obeying the regulation, we may have to consider bringing in the fines for social distancing. So even though you have a bar, even though you have places, once you have that social distances. And why I bring it in? Because if you ease up the amount of persons getting exposed, the community spread, you would have less strain on the system, less need for vaccinators to be here. And this is why I wanted to say we need that. So the fines, I'm thinking. The minister also said he was deathly afraid of persons partying when the SU ended. And like him, I am also deathly afraid of that, you know. So we have seen people now fatigued, just being locked up. And after the SU has ended, we may think that there will be an infringement where people will not obey properly. So we really have to be looking out. We have to have the vaccinators on board. We have to convince people now to come. So it's really a time where the war is arming our vaccinators with needles and syringes and trying to convince the population. So those vaccinators, sir, are exemplars of service. They have given service to the population, and we have to be thankful. So when I looked at the fact that you had the emergency ambulance staff, 49 came on board, pharmacists, 163, nursing personnel, 82. And the fact is, our legislation here went a stage further than some of the other legislation abroad, where they would have distinguished different nursing personnel to say, well, you know, certain nurses like midwives will come on board, emergency nurses will come on board. But we try in this legislation to encompass all. So we are giving all a chance, nursing assistants, nursing personnel. And, you know, the fact is trying to catch as many persons out there as possible. Then there were 123 dental interns and dentists who came on board to assist, 49 veterinary surgeons. And the fact is, we are proud of the 466 vaccinators that came on board, the non-traditional medical ones that also came on board. We are proud of them in their fight, and I think we have to congratulate them. And I must mention what I'm seeing, sir. What I'm seeing really is there's a burnout even among our vaccinators. So initially they came with the hope that we would help. We would get Trinidad in a better place. We would have ended this battle probably within a year. Now we are seeing with the Delta strain, with the variant, we are seeing now some of them are becoming in a sort of negatively influenced, because they said, look, we went out there, we give our service, but now we are seeing a battle that some of them say it's a losing battle. So the vaccinators themselves, yes, we are bringing them in, but we need to somehow give them that extra benefit or that extra encouragement. And Senator Gopi Singh did mention the fact that we may have to look at the remuneration for them, which I would try to come on to later. But, you know, so I find what I must mention, so though, I found it a bit puzzling that the state of emergency is ending 2 weeks before. I and other healthcare professionals would have hoped we would have seen it to the end. We know it's a balance between people lock up or people feel they are locked indoors. We know the business community. But you see, right now with the Delta fallout we are seeing, with the rising 10% cases we are seeing nearly every week, a rise in 10%. With today, when we heard there were 15 deaths and 414 cases, with that scenario, I think we would have felt as healthcare professionals, give us a little more breathing space, give us that 2 weeks. So it was a little puzzling, but here we are. We will have to face with what we are facing. And especially when we realize that most of the deaths were really 25 to 49-year-old, we really have to take into account the Minister of Health's concern of people partying after the SOE ends. And we have to make sure that we each do our part.
Senator, just allowed you a little breathing room to tie it in specifically to what we're doing here today with the 7 clauses and the addition of personnel. I don't want you to go too broad into the SOE and that coming to an end and whatnot. So if you can move forward from that particular point and just keep it in line with the fact that we are adding personnel by way of these 7 clauses.
Sure. Thank you, sir. So I was just hoping to achieve that if the SOE has now diminished, we will see more cases and we need more vaccinators. but the vaccinators are burnt out. So we need now how to manage them. So what I'm saying is that besides the vaccinators, we also have to ensure that we not tire out our vaccinators or make them disillusioned. So all the fines that we have placed so far, we may have to consider even increasing those fines. We may have to consider other avenues that we may have to get people to stay in line to prevent that burnt out that we are seeing. Even so, if you allow me, I am suggesting, I think one suggestion I have is like even the bars. I am hoping that even it's within the legislative power to say, bars, listen, from Sunday to Thursday, close at 12, and Friday to Saturday, open as normal. Just to give that level of productivity as well as responsibility, as well as the wholly in that level, of unrestrained people may have when they are partying. So therefore, the need to have the increased vaccinators, I see it's there, I support it all. I see also the need to encourage the vaccinees more to come forward, those who want to come forward. And so some people may fear too. Some people fear vaccines before. There's the conspiracy theorists, there are different people who are a bit skeptical because the novel vaccines that are there, even though we grew up in a time when the school van used to come and give us vaccines and nothing used to really happen. But now with the fact that these vaccines are all recent, vaccines are on the scene, people have that skepticism. We have to understand that, and we have to keep supporting them. Now, people are very scared. I want to make mention to the fact that we have opened up the personnel. So one person came to me and said, Doc, I went to get the vaccine, but I saw my vet there. And right now, you all are giving me an experimental vaccine, and it's a vet going to give me who's a custom injecting my dog. So all that are fears that we have now. Our duty is to let the public know that those persons have undergone some training. Now, I remember Senator Gopi Singh was mentioning about the training, but the Minister of Health did in fact mention the fact that there were some training in place. And I will just, if I get some time, I will just want to compare the training that occurred in the UK to our training, because I'm thinking if the vaccinators are coming on board, but people are scared of them, we have to convince persons that they got some training, but they need additional supervision, and this is what I think we need. So therefore, what I also welcome also is the fact that I got comfort when the Prime Minister mentioned the promise to increase the ambulance service, the ICU beds, and the option of buying antiviral drugs. All those, I had got a level of comfort. I got a level of comfort when the sentinel doctors were there given vaccines to give out to. So it's not just persons may have to go to these sites where these vaccinators that they are still trying to get accustomed to. They should know that they can go by the sentinel doctors. I have gotten the Sinopharm in my office, and Dr. Rai Radbir, the opposition member of parliament, has been given these vaccines and have actually been giving it out in his office. And people may come to a doctor because they trust the doctors more than out there. And the bill also asks for other vaccines to be allowed by the order of the Minister of Health. Now, other vaccines, yes, there may be other disorders that may come, that we will have to be rushing to develop vaccines, but it has to be ones approved by the Minister of Health and the World Health Organization. I don't think this should really go into the domain of influenza vaccines, as Senator Gopi Singh mentioned, because you see, we already have a system in place for that. And to let the non-medical personnel start to give out other vaccines, I think, in a time of crisis with COVID, yes, but if we are accustomed giving out vaccines before, I don't see that there's a need to give out flu vaccines. Regrettably, we have a decrease in population coming in for vaccines. It's a challenge. And also the Minister of Health said, they are not really giving booster vaccines yet. So people are asking, if they are not giving booster, why do we need this additional vaccinators on board? But you see, So the Minister of Health said we are giving additional vaccines for those who are HIV, immunocompromised, cancer treatment, on anti-cancer treatment, on autoimmune treatment. And he has not given a commitment yet. But I foresee in the future, as other countries have given the need, have recommended the need to give boosters, even the Johnson & Johnson, which was a single dose which people wanted, we now have 2 doses for that. So other companies have seen the need to give an additional booster because the immunity is wearing out. So I think this is a wise choice the Minister of Health may have had, but he did not yet commit himself to the boosters. So while I want to look at the fact that we had a variation ordinance before in 1920, which actually it was used, it gives the idea about training, and it's really more for like smallpox vaccine, smallpox injection. So we had that ordinance before. Then we had the Medical Service Ordinance number 15 of 1921 also, where it said that it is government medical officers.
Senator, like I said, we're dealing with 7 clauses.
Yeah.
The increasing of the type of personnel that can administer vaccines. You don't need to go back into the type of ordinances that we had in history.
Yeah.
So you can move on from that if you have another point to bring forward.
Yeah. Thank you, sir. I was just trying to develop that the Medical Service Ordinance. Actually, they gave the government medical officers as the ones to do the vaccines, the vaccinators. And they also make mention, like nurses and those other personnel, that, there were provisions under the Medical Board Act under that persons could give these vaccines under the supervision of a medical practitioner. So I'm trying to develop the point that Senator Gopi Singh made mention of, that you really have to have a medical person available. And I want to go a step further. I am a medical person, but I may not be up to date with the emergency life support techniques that they have available now. So when part of the training, not just for vaccinators, but even for the doctors who are supervising these places, these persons. So I need to emphasize the importance of this, because you see, so I just want to give an example of an adverse reaction, as Senator Gopi Singh said, could occur. This was a patient who gave permission to name herself and the case. She's a patient called Sharifa Mohammed from number 2 Bamboo. She went for her first shot, Johnson & Johnson, at the Health Services Unit at UWI.
So, Senator, you don't really need to go into the example if it is that you're repeating a point that someone has said before, where they also would have made that point pretty well. Mm-hmm. If you're just in support of that point, which you've already indicated you are, then you don't need to go further into giving examples, especially specifically dealing with a particular individual and what
yes.
occurred with them. So, in relation to that example you're giving, you don't need to, you can move on.
Yeah, but so what I wanted to give here is an example of the system working. You see, we got an example of an adverse reaction. Now, this patient told me she had an adverse reaction. She had an allergic reaction. Her throat started to clamp down. And her doctor, Dr. Charya Ramcharan at the UE clinic, was able to administer medication. So this is a success. This actually shows that what the Minister of Health had in place, that he would have the emergency trays, he would have the doctors there available. And even he was criticized initially when some health centers said they were left out in certain areas. But the logic behind it is you have to have well-equipped emergency trays with personnel trained to handle it. You just can't helter-skelter put vaccines in every corner. So the point I want to make, this was a patient who praised the service, who said, hey, it saved me, things were in place, and we have to congratulate the health services for that. So this bill serves to amend, I think, it looks at 6 parent clauses to allow these persons to administer these vaccines, the additional staff. I made mention the fact that, the UK also, sir, brought in this piece of legislation where they actually had. So it's not to say we are suddenly just making up to bring in other personnel. The UK had the occupational health vaccinators. They had the human medicine coronavirus and amendments in 2020, where they brought in staff, just as how we are attempting to do here. They brought in pharmacists, physiotherapists, paramedics, just as us, and different strategies of nurses. Canada, USA also brought in staff. There's a public readiness and emergency preparedness act, where the PrEP Act in the United States, where it actually brought in people, but there was a difference. That PrEP Act actually gave coverage to provide liability protection. And I mentioned that because Senator Gopi Singh did mention the fact that there would have been, he's a bit concerned about what would happen if there are certain adverse conditions. So I just want to say we have to have some solution to that. And, we have to really continue to prevent any sort of adverse effects. We have to educate the population that, yes, there are very rare side effects. So, so there are very rare side effects that occur, but we have things in place like the crash trays. We have to ensure the crash trays are well equipped. And sometimes, you can have probably 1 million chance that you can suffer adverse effects. But what I would really like to say, we cannot have the public lose trust and confidence in science and scientific method and what we are doing. We have to explain to the public, we have to explain to the public who are getting these vaccines that there are certain ill effects that occur. That is not really serious. And if you allow me, sir, there's something called COVID-arm. Yeah.
Again, Senator, it's not a debate in relation to COVID and what needs to be done by way of education and whatnot. This is a very specific bill, specific clauses that allow for specific things to happen. And it is within that context which you've been doing for most of your contribution. But anytime you veer off into a wider COVID debate, you run afoul of the standing order in relation to relevance.
Sure.
So keep it in relation to the increase in personnel that would be now allowed to give vaccines, and if you want, in response to anything else that has been said before, without repeating and drilling down into what has been said before.
Okay. So what I would, thank you, sir. I would like to just make rebut a bit about the fact that persons out there think that there are so many adverse side effects. And if we are going to have vaccinators on board, the vaccinators should be aware, and public out there should be aware. There's just, yes, okay.
So that's a repeat of the argument which you yourself said, which Senator Gopi Singh said as well, in relation to training. So that's where the rehashing of the same points are coming up, and tedious repetition comes into play. So that's what I'm saying. Be careful, move forward, new points.
Okay. So while I would move forward that, there are conditions that we need to be aware of, SERVA, which is a shoulder injury, we need to be aware of COVID-arm, we need to be aware that there are instances out there that the medical doctors could alleviate their fears. And the training that I think we had mentioned before, we have to realize that when people ask for proper training, we have to appreciate the fact that I think the ministry did have, a module, and they had certain persons actually train these vaccinators on their need for storage and side effects and all these things. And it was really, they followed the modules that the WHO had given, the 6 module the UNICEF had for these training. So I have to say that the training aspect is there, but we may have, and we did follow, I see guidelines, international guidelines, so I'm satisfied about the training, but we have to keep reminding the persons and to see that they are, under the guidance of a doctor who would be able to look at any adverse effects and also let the vaccinators know that, remind them about the proper techniques. Mr. Vice President, it was mentioned about the fact about the volunteers not being paid, and I just want to make mention to the fact that in UK, they do in fact pay some of the program registered vaccinators. Yeah,
So when you say it has been mentioned, and then you go on to lay on an example on top of that in another country, again, tedious repetition comes into play. There's no need to further make the point. If you are passing over the point in support of, that's okay. But when you drill down into it further, then you're being tedious in terms of repeating things that have been said before. So I've heard what you've said. If you have a new point now, you don't need to go into what has happened in the UK. You've supported it. We've heard it. If you have something new after that, I invite you now to bring it forward.
Thank you, sir. So my suggestion was just as how the UK could consider that. If we cannot consider that down here, we should probably give some level of certificate to these vaccinators. So in the past, in the future, when they are going for jobs, they would have that level that they did participate in a national effort. And somehow if they're going for any government jobs after it, so it comes like they give service to their country. And even though it's not monetary rewards, we can still offer them this certificate to say they did come forward to help the country and assist the country in times like this. And again, if I have to hire certain personnel in my office and I see they have this sort of certificate, I may be tempted to say, well, you have one up because you showed me you have that level of service and that dedication. So I must mention that, make mention to the fact that if you are given these vaccinators the ability to actually give these vaccines, it was mentioned, would a pharmacist now go on his own and decide he wanted to give a vaccine? In the past, we had cases where some pharmacists were given contraception injections. I knew of cases where some gym instructors were given testosterone injections for carnival. So we have to be aware, and I'm hoping that we can get some clarification on these, in this bill, that, if we are looking to give these personnel the permission to give the vaccines under the guidance of a doctor, we should also have, if there are any potential for abuse or they go out on a frolic to think they are doctors to give injections, we should always have something tied into the legislation to have some sort of a punitive measure that if they decide they want to move away or on their own give vaccines, be it a pharmacist in his pharmacy, and I'm speaking about other vaccines now, so not just the vaccines that are given via the permission of the Minister of Health. So as I close, I may say I support this move. I think we need it. I think we need to evolve our fight from what is happening out there, because the virus has been coming to us in different forms. While we are thinking we are conquering it, it's still out there. And we need to evolve our way how to fight it, be it more personnel. And we have to learn how to adapt. We have to learn to set the proper example. One thing I might say, sir, I was a bit disappointed, even though I'm so happy that the promises we got from our Prime Minister recently with the ambulance and etc. I was disappointed when I looked at the COP26 conference and world leaders were without their mask. I think we have to send a better message, and I'm thinking we don't want anything to happen to our world leaders, and I'm thinking that we may have to keep reminding them we need them around a long while from now to help us in this fight and to be a little more careful when they're out there. Thank you, sir.
Senator Vera.
Thank you, Mr. Vice President. My difficulty with this bill is that it's an uninspiring continuation of government's singular reliance on the use of vaccinations to end the coronavirus pandemic. The belief is that if we all get vaccinated, this pandemic will end. But this belief is open to doubt when one considers the current resurgence of COVID in highly vaccinated countries. According to the BBC, infections have spiked in the Seychelles, reputedly the most vaccinated country in the world. Mauritius is now imposing a raft of new curbs and health protocols, despite having one of the highest vaccination rates in the world. The Cayman Islands, with a population of 65,720, had 751 new cases of COVID on the 11th of November, even though 83.2% of its population is fully vaccinated. The Dutch government just announced a further lockdown after over 16,000 new cases were recorded in one day, even though 84% of Dutch adults have been fully vaccinated. Despite a high vaccination rate, Germany and Italy are also confronting a surge in cases, and the WHO is warning that Europe is once again at the epicenter of the pandemic. Yet the state of Uttar Pradesh in India, which has a population of 240 million and only 20% of its population fully vaccinated, reportedly has less than 10 new cases. What's going on here? As much as we want to believe in the effectiveness of vaccines, and as much as we want to see COVID disappear, we are not seeing a reduction in the spread of the virus where communities are highly vaccinated. So please forgive me for expressing skepticism about government's monochromatic approach and the thinking behind this legislation. I am skeptical about government's religious reliance on the WHO and what I regard as questionable guidance and protocols. I am skeptical about closed-mindedness, which excludes and withholds other viable treatments. I'm skeptical about vaccine coercion, especially where children and those who have recovered from COVID naturally are required to be vaccinated. I'm skeptical about hailing vaccines as the only proven solution when their purported attributes keep changing. For example, we are now being told about the waning of immunity and that boosters and further shots will be required. I'm skeptical about government safe zones policy, which ignores the fact that fully vaccinated persons can catch and pass this virus. Even if they have no symptoms, they can be just as infectious as those who have been jabbed, as those who have not been jabbed. There is a risk of people being lulled into a sense of false security with these safe zones. I am skeptical of policies which play to our fears. And before going further, this is an opportune time to declare once again, I'm not an anti-vaxxer. I am fully vaccinated. But I encourage honorable senators to look long and hard at government's strategies, policy decisions, and public actions geared towards dealing with this virus. We must be willing to challenge the data and be open to rigorous debate. Now, while I accept that vaccinations have an important role in the fight against COVID, I do not accept that they're the panacea in and of themselves. And it is not unreasonable to ask questions about them. Nor do I think it is right for persons in high authority to disown those who question the efficacy and safety of vaccines. Citizens are entitled to make informed choices regarding their health and well-being, including the right to determine what can and what can't be injected into their bodies and those of their children. Individual autonomy is a right. People should not be pressured into taking vaccinations based on panic-inducing headlines. And it is wrong to dismiss legitimate concerns as paranoia or conspiracy theory gullibility. For anyone who doubts whether there are risks associated with COVID-19 vaccines, I invite them to check out data recently released by the CDC under its Vaccine Adverse Event Reporting System, showing a total of 875,563 adverse events following COVID vaccines between December last year and early November this year, including a total of 18,461 reported deaths and 135,400 reports of serious injuries. Particularly disturbing is the fact that in the United States, some persons were inappropriately injected, presumably by trained medical professionals. And this is cause for pause when considering this legislation. Vaccines being administered by medical-related personnel, supposedly under the direction and supervision of medical practitioners. Will the fruit of this legislation be sufficient safeguard when injected persons suffer anaphylactic shock, or go into cardiac arrest, or have life-threatening hypersensitivity reactions requiring immediate treatment? Now, I have no doubt that if any other drug had had as high numbers of adverse events as reported in the US and elsewhere, use of that drug would have been discontinued immediately. But as they were initially administered under emergency use authorization, the COVID vaccines got a bly. Yet it cannot be denied that these drugs were rushed to market and are yet to establish themselves as providing immunity against COVID. Now, I use the word drugs deliberately because unlike conventional vaccines, which rely on weakened and inactivated pathogens or a fragment of pathogens to trigger an immune response, these treatments are different.
Mr. Vice President, as much as I like to hear my honorable friend, I have to raise 46-1, please.
Yes, Senator Vera. So, as much as I've allowed you some leeway to create the context coming into the debate, what is happening is that it's becoming, as was the case as I indicated with Senator Dayal Singh, a broader COVID-19 debate. What we're dealing with specifically is the introduction of new personnel to apply vaccines. When you're going off into the efficacy of the vaccine, it gets a little bit too broad in terms of what we're dealing with specifically. So I'll ask you to tie it up and tighten it to specifically the 7 clauses in the bill.
Thank you, Mr. Vice President. But just to be clear, the Attorney General did talk about the global situation. He did say that vaccination is the best response. He did say that it's the proven solution, being the approved WHO vaccines. That in a nutshell, that is what this bill is about. He has made a plea for all eligible persons to be vaccinated because the benefits are undeniable. And so we're talking about life and death. We're talking about a trigger event that's going to change everything. And we do need to have at least an opposing view, something to challenge what is being put out there. So I am guided, sir, but I would ask you to just bear with me. I won't be long. I was going to say that these are not the conventional vaccines. These treatments are different. They use a new approach whereby a cocktail of drugs using messenger ribonucleic acid, or mNRA, as the active ingredient, is delivered into our cells to make spike proteins meant to trigger an immune response inside our bodies. So they don't use the live virus which causes COVID-19. Are they really vaccines in the traditional sense of the word? And we know they do not provide the kind of immunity one gains when using the tried and tested vaccines that we have, for example, with polio, measles, mumps, rubella. Now, I'm not disputing whether these drugs work. I want to believe they do, but they're different to conventional vaccines. That's all I'm saying. Moreover, and as stated from the outset, this legislation is predicated on the belief that if everyone gets vaccinated, it will stop the pandemic. But where's the proof? The Chinese have a saying, you could call a cat a fish, it still won't swim. Similarly, how can we assert that vaccines will end the pandemic when the original notion that fully vaccinated persons can't get COVID, fall sick, or die from it, that notion has been debunked? And how can one assert that vaccinations will end the pandemic when countries with low vaccine rates appear to be doing better than their more highly vaccinated counterparts? COVID is not untreatable, but it will take humility and open-mindedness to find the right method. In the meantime, I believe people should be encouraged, not discouraged, to get out in the open, whether it is to exercise, play sports, go to the beach, or just to have fun. Sunshine and clean air are natural enemies of this virus. Instead of fear-mongering, we should be promoting healthy lifestyle, defined by WHO as a way of living that lowers the risk of being seriously ill or dying early. Health is not just about avoiding disease, it's also about physical, mental, and social well-being. Government should allow alternative treatments and remedies to be readily available, even if it doesn't want to officially endorse them. We should be finding ways to assist those who have been financially crippled by the restrictions and lockdowns in reaching a resolution in arrears disputes and unpaid debts, including service charges and interest, by devising statutory restructuring plans, schemes of arrangement, and guidelines for voluntary settlements, whether in the case of small business, landlord and tenant, financial institutions, and customers. Government must improve the working conditions and terms of employment for our nurses and our frontline workers. It is time to stop the exodus of caregivers after having committed time, energy, and resources in training them for the benefit of other countries. If we want to sincerely thank medical personnel, government should be doing everything in its power to keep our health care workforce happy and wanting to stay here. Even if we authorize additional personnel to administer COVID vaccines, as this legislation seeks to do, the fact remains that vaccinations do not prevent infection and will not stop viral transmission. In my respectful view, government needs to pay close attention to what's happening elsewhere and not just blindly follow the WHO's linear approach. The Ministry of Health confirmed yesterday that fully vaccinated people have died in Trinidad and Tobago. Are we to downplay these deaths as aberrations, so-called breakthrough cases? As far as I am concerned, there are just too many anomalies. And I would ask the Honorable Minister of Health, through you, Mr. Vice President, on behalf of the citizens of Trinidad and Tobago, to follow the science, do the research, connect the dots. We should be asking ourselves why some countries are now moving away from the vaccines. Why is Finland, Sweden, Denmark, and Norway limiting the use of the Moderna vaccine in younger age groups? And why are people questioning what appears to be bioethics violations on the part of Pfizer? Crisis is a driver which requires us to change and adapt. We need to stay vigilant, especially when new findings force us to reconsider whether the vaccine rollout is the best or only viable policy. I thank you.
Acting Attorney General.
Thank you very much, Mr. Vice President, and to members of the Senate. As I wind up this debate today, there are just a few points that I must address. Allow me to start off, Mr. Vice President, through you, to put on the record that in Trinidad and Tobago, these are facts. This is not speaking hypothetically. This is not reading about any alternate jurisdiction. In the Republic of Trinidad and Tobago, we have administered 1.2 million COVID-19 vaccines. So let us put this into context. This is not, if we do this, we should have done that. We have administered 1.2 million WHO-approved COVID-19 vaccines in Trinidad and Tobago, and have been informed by the Ministry of Health that out of those 1.2 million administered vaccines, we have had less than 10 adverse events. So to pick one event, or maybe two events, and try to make that about the whole vaccination would really be a little less than honest. And I'm not suggesting that any previous speaker did that. So we now know that that is what we've done here in Trinidad and Tobago. This bill is not about COVID-19 vaccines and the efficacy of COVID-19 vaccines, but I must respond to the last speaker, and I am not a doctor, I am not a scientist, but I have been part of this government's management of COVID-19 now for almost 2 years, meeting on a weekly basis with our medical health personnel, and sometimes more than that, and being briefed on a daily basis. No one is saying that by being vaccinated with WHO-approved COVID-19 vaccines, you will not contract the virus. We've not said that. That is not a fact. It is still possible to contract the virus. However, this is no longer about the number of positive COVID-19 cases, because we can see on a daily basis right here in Trinidad and Tobago, where you have on some days of last week over 500 new positive cases. What we look at in the management of COVID-19 is how many require hospitalization. So out of over a 3-day period where you have over 500 cases, 1,500 new cases, how many out of 1,500 new positive COVID cases required hospitalization? That is what you look at when you're managing COVID. And we also know, because we've been told, and it's factual, by again our public health experts, over 94% of the persons who require the highest levels of care are unvaccinated. That again is a fact. So you know that out of every 100 persons requiring hospitalization as a result of being positive for COVID-19, 94 of them are unvaccinated. I heard it being mentioned that there are some people who are fully vaccinated that have unfortunately passed away. I know, because I have been exposed to the facts in the briefings, those persons who have been fully vaccinated either contracted the virus during their vaccination cycle, or the vast majority of them had serious comorbidities, had things like dialysis, renal failure, all not associated to COVID, and some of them were elderly for example, over 80 years old in life, and one can say that unfortunately they were in the latter part of life and on their way out, and COVID may just have done that for them, in addition to comorbidities and other serious prevailing medical conditions. So I would not want anyone to walk away. Everyone is entitled to their own opinions and to their view of the world. But to say that the government's following of WHO is less than advisable, or to say that vaccination doesn't have benefits, I'll put it as neutrally as that. There must be, and there are, and it is scientifically proven that there are benefits of vaccination. And we now know, because it is less than 2 years the world is dealing with COVID-19, it continues to evolve. We continue to learn from the science. We continue to learn and see how the virus has mutated, how we've had to deal with different variants, how different variants have reacted, how the vaccine works, etc. What we do know is vaccines have been saving lives. There is no doubt about that whatsoever. As I say, this bill is not about the efficacy of the vaccines, but I could not leave it unanswered or unresponded to by not stating these very pertinent facts. This bill, and what we're seeking to achieve by this bill, is really expanding the categories of persons who legally can apply in specific circumstances the COVID-19 vaccines to persons and administer it. That's the first part of it. We're expanding it. I don't need to go back through who are the categories of persons. There was a lot of suggestion, and I just want to go to the first speaker, Senator Gopi Singh. And I couldn't help but write down in listening to him, in particular coming to the end, it sounded like a red herring contribution, a tongue-in-cheek contribution, or a boogeyman contribution. Choose which one. Let's focus on the training. We've heard the attack on medical personnel. We heard the attempt today to try and retract, to do a Michael Jackson moonwalk backwards away from attacking certain medical personnel. Today, for the first time, we're hearing a suggestion that there's not sufficient training. We have in our presence a number of medical personnel. I was told by 2 senators on the government side, both Dr. Amory Brown as well as Dr. Ibrahim, in your first year, the first year of medical training to be a doctor, a dentist, a vet, and a nurse, one of the courses that you must pass is the administering of injections, including vaccines. So to come here and to tell the population that you don't think recently qualified medical doctors should be allowed to vaccinate people, complete rubbish. And to make that suggestion, again, is trying to mislead the population, to fearmonger. I also have here in front of me the training that is provided by the Ministry of Health. Again, real time. The proof of the pudding is in the eating. 1.2 million vaccines applied in Trinidad and Tobago. Successfully applied, less than 10 adverse events out of 1.2 million vaccines. And then you'll come and raise the issue of training and suggestions that it may not be sufficient and you have fears. We are dealing with a pandemic. We are dealing with the reality of loss of lives on a daily basis. And one of the accepted pillars in responding to that, because nothing is foolproof. Nothing is 100% guaranteed. Very little in life is 100% guaranteed apart from death. This is just one of the pillars in the government's response. And we've come here today to prepare ourselves for what we're dealing with now and what may come in the future. The protection of this bill is that it has to come via an order of the minister for any additional vaccines to be applied by these categories of people. Let me just complete the training point. I completely disagree with Senator Gopi Singh. The The facts are there that all of the people who have been administering these vaccines have done so successfully. There's the training, there's the responses. I said that the parent legislation cannot provide for where vaccines can be administered. You have no idea what may happen tomorrow or 10 years from here. God forbid a hurricane wipes through the country and then we have a need to apply vaccines of a different nature and there's little infrastructure in place. You're going to say, well, it's said that it can only be in a hospital or a health center or a building 10 by 4. You don't put that in parent legislation of this nature. That is an administrative exercise. Again, the proof of the pudding in that having been done successfully in Trinidad and Tobago is for the past few months, from April to November in Trinidad and Tobago, 1.2 million vaccines successfully applied and administered to people in Trinidad and Tobago. And the settings all worked. I had the opportunity, being fully vaccinated myself, taking my children to be fully vaccinated as well, to go to at least 3 different places to have the vaccine administered to myself and my children, and to see how effortlessly, how the flow worked. So we are not talking about this is what we may do, that is how we should do it. We have done it 1.2 million times. The infrastructure was there, the people did it successfully. So let's waste time talking about the what ifs. In the future, if it needs to be applied, we have to trust whoever is the Minister at Health at the time, because he or she will have to issue an order for that additional vaccine to be administered by these people. As Senator Diyal Singh said, tomorrow, the state of emergency, it is intended it be revoked. These people who have been administering vaccines and helping us in this scheme as one of the pillars of response need the coverage to be able to continue, and we've gone directly to the parent legislation. It sounds nice to talk about vicarious liability. It sounds nice to talk about liability and if something goes wrong and NDAs and the coverage from the vaccine suppliers, etc. It applies on a daily basis. If you or I, God forbid, have an emergency incident and a medical healthcare professional, a paramedic has to come to you, where's the liability there? It is what the law is. This doesn't change that in any way. If someone applies it negligently, that is the law of negligence. The law protects, the law provides. It doesn't come in this legislation. So again, that is another red herring. The Minister of Health has provided one of the examples of the efficient and I have to say well-populated training that has been implemented for these persons who are administering the vaccines. I have here a schedule from 8 in the morning to 3 p.m. and how these training sessions went for those persons who needed training to administer the vaccine. And it is broken down into a number of doctors, a number of specialist personnel, giving them, it contains management of adverse events, one of the issues raised, the process of vaccine administration, the cold chain, how vaccines work, the type of vaccines, the expanded program of immunization, the documentation, how to fill it out, the questions and answers, and then a demonstration. Again, we're not speaking hypothetically, we're not speaking this is what should happen. It has happened. It has been successfully applied to 1.2 million people in Trinidad and Tobago. Just allow me to just check my notes, Mr. Vice President, so I can wrap up. One of the first points by Senator Gopi Singh was how many persons are needed to provide mass vaccination. Again, don't raise these red herrings. We've done it. It has happened. Medical interns should not administer vaccines. I've dealt with that. Where they will give the vaccines at the sites, where is it going to be? Again, that is an administrative issue. He talked about those with 2 vaccines who passed away. I've explained those few occasions, what those persons, what those individuals were suffering with at the times. This again attempt to moonwalk backwards, that the leader of the opposition or no member of the opposition ever attack the medical practitioners, and then for them to focus their attacks on those who are advising the Prime Minister, the Minister of Health, and the members of Cabinet who are trying to manage for the people of Trinidad and Tobago our response to COVID. That is completely untrue. We all heard it. I remember waking up that Sunday morning and seeing on Saturday evening the leader of the opposition putting out a vile, abusive statement attacking the CMO, attacking all of those doctors who were there offering their advice and helping this country to manage COVID. And as a citizen of Trinidad and Tobago, I have the opportunity to put on Hansard. We reject that. That is wrong. Don't attack the politicians all you want, because it's unwarranted 98% of the time. But then to start attacking public servants, you can't backtrack from that now. It is a fact. It happened. They have a way that they always are trying, the opposition, to rewrite history. The population has seen it, and they've rejected it, and we reject it. The legislation is too vague as to who can administer the COVID-19 vaccine. The legislation is clear. This is amending parent legislation. You have to go to the parent legislation of these 6 different acts to see the various definitions, etc. It is clear. There's no vagueness about it. What vaccines in the future? We can't predict now, today, what are the vaccines in the future. A Minister of Health in the future may want to add via order, but there's a process, a legal process and an accepted process that we're passing here today. So, Mr. Vice President, I ask that the Senate continue to apply the common sense, continue to do what is right, continue to work with the government as we respond to the COVID-19 pandemic. And this bill here today is just one small pillar in giving us the tools. It was again, I think, Senator Diyal Singh, who said you're at war and you basically need an arsenal, you need tools to go to war with. This is one of them. It's been applied in other jurisdictions. It's been successfully applied here in Trinidad and Tobago as we've responded to the pandemic. And I ask that all of you senators join us here today and let us just pass this simple legislation to allow us to have that in our toolbox, the arsenal, as we continue to manage and to fight this ungodly virus that is COVID-19. I thank you. I beg to move.
Honourable Senators, the question is that a bill entitled An Act to Amend the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, the Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus vaccines under the discretion and supervision of medical practitioners be now read a second time. Those in favor say aye. Aye. Those against say no. I think the ayes have it.
A bill entitled, An Act to Amend the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus 2019 nCoV vaccines under the direction and supervision of medical practitioners.
Acting Attorney General.
Thank you, Mr. Vice President. Mr. Vice President, in accordance with Standing Order 66-1, I beg to move that the miscellaneous provisions 2019 novel coronavirus 2019 NCOV Vaccination Personnel Bill 2021 be committed to a Committee of the Whole Senate forthwith to be considered clause by clause.
Honourable Senators, the question is that the miscellaneous provisions 2019 novel coronavirus vaccination personnel bill 2021 be committed to a Committee of the Whole Senate forthwith to be considered clause by clause. Those in favour say aye. Those against say no. I think the ayes have it. The Senate shall now go into Committee of the Whole to consider the bill clause by clause. Honourable members, this particular piece of legislation has 7 clauses, and so we shall now proceed. As far as I'm aware, no amendments have been circulated.
7.
One to seven. 1 to 7. Yeah. Do you have any amendments? Yes? Okay. All right. So we'll take it one by one then. Okay.
Clause 1.
No, yeah. One by one. One by one.
Clause 1.
Honourable members, the question is that clause 1 stand part of the bill. Senator Mark?
The Honourable Minister to consider after the word order. Is it clause 1 or clause 2 we answer?
Clause 1, Your Honor. Clause 1.
Okay, clause 1. All right, I'll wait until clause 2.
Okay, fine with clause 1.
Yeah.
Honourable Senators, the question is that clause 1 now stand part of the bill. Those in favour say aye. Aye. Those against say no. I think the ayes have it. Clause 1 now stands part of the bill.
Clause 2.
Honourable Senators, the question is that clause 2 stand part of the bill. Senator Mark.
In clause 2, there is an amendment that talks about or such other vaccine as the minister may by order prescribe. Because of the extent of this arrangement in which we are going beyond the COVID-19 vaccines and extending same to other vaccines, we would like to put after the word order, subject to an affirmative resolution of the Parliament.
Attorney General.
Thank you very much, Mr. Chair. I have heard what the opposition have proposed. The truth is, and it's something I should have responded to in the wrapping up, a lot of talk about the application and the administering of vaccines has fallen from the lips of those on the other side and the potential risks, etc. This is nothing new. We've been vaccinating people for well over a decade. These categories of people have all been trained. We have to be able to trust whoever is the Minister of Health at the time. He or she must have a good, a reasonable reason. It must be justifiable. If there is any issue with it, someone, of course, can challenge that in court. So I don't think at this time we're going to go with any affirmative.
Mr. Chair, if I may, I think the Minister is absolutely wrong on the point that he has raised. Before the COVID-19 pandemic, the only persons authorized to administer vaccines fell under the Medical Board Act, and that had to be prescribed by or recommended by a doctor. So a nurse could have done it, a registered nurse. But what has happened, Mr. Chairman, with the COVID-19, we have had to get other persons on board, as the Minister said, because of the pandemic. So we understand that. But what the minister has done in this particular clause, Mr. Chairman, is that he said beyond the COVID-19 vaccines, any other vaccine. So, Mr. Chairman, what we are saying, this is a new development that we are getting into. And therefore, in those circumstances, we as a parliament would like oversight as it relates to that power that they are given to the minister. And that is why we are proposing, Mr. Chairman, that it be subject to an affirmative resolution of the parliament. That is why we are doing that.
Senator Gopi.
Mr. Chairman, this here, what I support fully, my colleague, Senator Mark. I can't in my wildest imagination, being a doctor for 47 years, sit down, I earn my keeper, don't say, I earn my keeper
Continue,
as a
Senator
doctor for
Gopi Singh.
47 years.
Continue your contribution.
What vaccine do they have in mind, or what can be occurring in the future that we must sanction now that these people must be able to give the vaccine? What is that vaccine? Where is it coming from? Are they going to give mumps, measles, tetanus? We already have these can be given by doctors and by nurses. But you want an emergency medical technician to give a give a vaccine? Do you want a radiographer to give a vaccine? No, Mr. Vice Chairman.
Senator Richards.
Vice President.
Thank you, Mr. Chair. Mr. Chair, the Act is called the Miscellaneous Provisions 2019 Novel Coronavirus 2019 COVID Vaccination Personnel Act. Yet we're being asked to approve a clause which indicates any other such vaccine. So I would humbly suggest that this be amended to include in relation to the pandemic of COVID-19, because it is unthinkable to me that we could be approving or seeking to approve any other or such vaccine, as the minister may prescribe, which does not have any parameters that deals with COVID-19 as stated by the title of the Act. That's one. So, and two, the Honourable Minister Honourable Acting Attorney General, indicated during his wrapping up that the caveat related to the supervision of a medical practitioner is not necessarily a bad one, with the absence of some sort of timeline or experience related, because, the person can administer a vaccine you're taught to do that in your first year. But to me, the intention of having the supervision of a medical practitioner is not necessarily to administer the vaccine alone. It's to attend to the person should an adverse effect take place. So what is going to happen if the person is a first year and not experienced enough to handle that sort of situation? Are they going to call for an experienced doctor? So I think there is no harm in putting a 2-year experience or something to ensure that that supervisory person fulfills a wider responsibility to safeguard the personnel. So it's not just to administer a vaccine, you're supervising to safeguard a life in the event that something adverse happens.
Okay, so Attorney General, do you want to answer the three? Because Senator Vera has something to say, or you want to hear Senator Vera?
Well, can I just answer those and then come to Senator Vera? Okay. I don't think, respectfully, there's need for this level of, I almost use the word hysteria. At the end of the day, it's not a minister who administratively decides what vaccine it is. And to answer Senator Gopi Singh, as I did as I was responding, you can't predict what was happening. In December 2019, you couldn't predict there was going to be a pandemic on COVID-19 and how the world's response in terms of it would be. You yourself and your personal experiences, and you know how it has gone today. You praise the personnel, the nursing personnel, etc. As I said, in the first year of medical training, medical students must pass courses as to how they administer shots, not only vaccines, but shots. It was explained to me by the medical personnel. There are 3 types of injections that are given intermuscle, and these. I am not a doctor, but you know what that is about. I have heard the concern being raised. I've heard the concern saying that, well, how could you just let a minister? The truth is, a minister comes to the cabinet for approval for this and has to justify it based on what the medical personnel have advised. When we declared in this pandemic that COVID-19 had to be escalated, it wasn't based on listening to the Minister of Health. He brought before us all of the support documentation, the advice of the medical personnel at the Ministry of Health. It is the same thing that would apply here as to what is the other vaccine that may need to be applied. All right, this is not something that is going to be utilized. It's not for mumps, but it may very well be if something breaks out, if there is a virus breaking out on the southwestern peninsula or something, and it requires an emergency response. To deal with one of the points raised by Senator Richards, and it is a concern that he has because he raised it with me earlier. What about the surrounding environment of the administering of a vaccine, and what if something goes wrong? Again, that is something that is dealt with administratively. As we've seen here, as I said in the winding up, with the administering of 1.2 million doses of the vaccine. And that was done successfully, and there were less than 10 adverse events to it. We're not going to put any parent legislation here. We're not going to put here that it must be a person with 2 years experience, etc. If any one of us are in a circumstance, and it's an emergency circumstance, and for example, you're having an allergic reaction, and a medical healthcare person, a paramedic, or someone pulls up with the epi injection or whatever they call it, they apply it. So let us not become too paranoid here with the application of vaccines. At the time, we must trust that whoever is in charge will do what is right. You can't get into every prescription here with the expansion of these categories of people. If I may hear Senator Vera.
Senator Vera.
Thank you, Chair. Vaccine is defined in a way that allows a lot of latitude. A vaccine approved by the Minister of Health in accordance with the Food and Drugs regulations. Now, this legislation is solely about administering the COVID vaccines. So, given that definition, other vaccine must mean something outside coronavirus. And so, I share Dr. Gopi Singh's concern. I really don't think that we should even have this amendment or such other vaccine as the minister may by order prescribe. It should just be, may administer a 2019 novel coronavirus vaccine, full stop.
Mr. Chair, I heard what the... Thank you. I heard what the Acting Attorney General indicated just a while ago, that if something turns up very urgently, what would we do? But something turned up urgently, and they were able to deal with it under the emergency health regulation. So you have an avenue to deal with it through the emergency health regulation if something drastic is happening.
It's actually dealt with by the a state of emergency regulation, not emergency health
Well, you
regulation.
did it. You called for a state of emergency. But to give a carte blanche ability for whether Minister A or next 2 or 3 years Minister B or whatever, from a scientific perspective, I cannot see that we're giving a carte blanche ability for an emergency technician to give a vaccine when they would. What about the training that was required? You're saying that the emergency technician now can give it. You're saying that a paramedic could give it. You're saying that a radiographer can give it. And even a pharmacist. And pharmacists are not trained in Trinidad under the Faculty of Medical Sciences. They are not trained in administering vaccines and even taking blood from patients. That is against the thing of a citizen. Pharmacists are not trained. So to give pharmacists an ability, In the United States and Canada, pharmacists are specifically trained. That's why Walmart and Walgreens and so on, they are trained and they're covered by on liability, yeah? They're covered.
So I will take Senator Mark, and then Minister of Foreign and CARICOM Affairs, and then AG will wrap up in response to everybody. Senator Mark?
Yes, Mr. Chairman, seeing that we were proposing affirmative after order, and that is causing a problem, and these amendments are in contradiction to the very title of the legislation, I would now want to propose on behalf of the opposition that we delete completely all such other vaccine as the minister by order prescribed. We are calling for the complete deletion. Since the government is not interested in an affirmative to debate it, we delete it because it is inconsistent with the legislation.
Minister of Foreign and CARICOM Affairs.
Thank you, Chair. I just wanted to respond to the assertion of Senator Gopi Singh. What is before us is not to give any carte blanche authorization to those various categories of ancillary healthcare workers. That's not what is before us. What is before us is to authorize the Minister of Health, and as the Attorney General asserted, in collaboration with the Cabinet, should he see fit to be able to issue an order to allow those categories to administer a vaccine where required. And Senator Vieira had indicated in his contribution that it would have to, we are talking about vaccines to something other than coronavirus. That's what's being anticipated here. I just want to say that it could be a coronavirus vaccine as well. Remember what is in this bill and what is before the country and the world right now is COVID-19. There could be a COVID-22. We do not know that. So this is really a forward-leaning, futuristic attempt by the government to ensure that there is some additional flexibility on the, provided to the executive, that should such a scenario arise in the future, we would just have an additional facility available to the Minister of Health. So it's not carte blanche, it's not eyes closed and, send them forth to vaccinate. It's not for measles or other endemic infectious diseases, but for a pandemic, an urgent threat to the public health, the Minister of Health should be provided with such facilities. So I just wanted to support the Acting Attorney General in this regard.
Attorney General, Senator Gopi Singh, I'll have the Attorney General wrap up now.
Thank you very much. I'd just like to put on record here, Mr. Chair, I thank my colleague, Dr. Brown, for his intervention, but I just want to put on record here and bring us back into context. There's no mandatory vaccination. Let's start with that. So this concept that you're just letting these categories of people go and administer vaccines to any and everybody, that doesn't exist. Right now, and it has been like this, apart from very young children, where it is being managed, there is no carte blanche mandatory vaccination. This is to provide for a future government that in the case of an emergency, they will have to justify it. As I use the example in the wrapping up, God forbid some natural disaster takes place, it wipes out our existing infrastructure, etc., and you now need to administer a vaccine that has come up for that particular circumstance. And as Minister Brown has just very eloquently pointed out, a minister, an individual, does not have that power to just go and add any vaccine to this list via order. There has to be a cabinet note, it has to be a cabinet decision, it is scrutinized by the cabinet, it has to be supported by the medical evidence. But again, to me, the important point here is it is not a mandatory vaccination scheme where persons will be subjected to these additional categories of people. This is really to be used in emergency circumstances. I can't say what the future vaccines will be, because as I say, in December 2019, I certainly had no clue this is where we would be in November 2021. So I've heard everything that all of the other senators have contributed. I've listened to it very carefully, and respectfully so far, I disagree with the proposed suggestion of an amendment.
So, Senators, at this point, before I put the question, let me just clarify. So, Senator Mark, you want your amendment put as a question?
Yeah.
Senator Richards, you also made a suggestion. Is the same applicable to you?
The suggestion is in support of Senator Gopi Singh's amendment, or Senator Mark's amendment, sorry.
So you're talking, so you're in agreement with Senator Mark's
Yes,
proposed amendment
Chairman.
to delete? Okay. So let me just say to all senators too as well, that as much as we do from time to time allow amendments to be put on the floor, that these pieces of legislation are circulated well enough before we start the proceedings of debate and then committee stage, that in the future going forward, if you can please try to circulate these amendments prior. It allows for more proficiency, efficiency, and more importantly, to allow all senators to practically follow what is taking place.
Mr. Chairman,
When we
if I
do
could-
it this way, one second, when we do it this way, it is usually where there's minor amendments, where it's easy to follow the wording of what is being adjusted in the legislation. That being said, so I remind each and every senator, please try, if it is that you have amendments, it can be done right up until the moment before committee stage to try and get these amendments circulated so that all senators can practically follow. Somebody was saying something.
Yes,
Senator Richards.
thank you, Mr. Chairman. Just to be clear, Senator Mark actually changed the amendment, so I don't know which one he's
Yes, so
proposing.
he's now suggesting that the words be deleted. So that is what everybody who has made a suggestion is agreeing to. So that is the question I'm going to put now. Honorable Senators, the question is that Clause 2 be amended as follows, that at Clause 2, 36A, 1, after the word vaccine, the words or such other vaccine as the minister may, by order, prescribe, be deleted. Those in favor say aye. Aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is, Senator Gopi Singh, there's no explanation to be had, so the question has been put.
No, I'm not going back there. I just want to make another.
So you want to make another
Yeah.
amendment?
When you look at the issue, a person who is registered as an emergency medical technician, paramedic under this act, acting under the direction or supervision of a medical practitioner. I want to substitute or and put and, under the direction and supervision.
Okay.
That will give some confidence.
All right. Honorable Senators, the question is that Clause 2 be amended as follows. At 36A1, after the word direction, the word or be deleted and replaced with the word and. Those in favor say aye. Aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is that Clause 2 now stand part of the bill. Those in favor say aye. Aye. Those against say no. No. I think the ayes have it. Clause 2 now stands part of the bill.
Clause 3.
Honorable Senators, the question is that Clause 3 now stand part of the bill. Before we move forward, let me just say that all of these clauses from 3 to 7 have that particular line which we just had a robust discussion on. I don't anticipate that we're going to have that discussion for every single clause. So let me ask this question again for efficiency. Is it that you want the amendment proposed on each of those clauses as it relates to this particular line being deleted, and Senator Gopi Singh, that particular word being deleted to be replaced by and? Is it that you want that amendment proposed on each clause? So be it. Honorable Senators, the question is that Clause 3 be amended as follows. That the words, or after the words vaccine, the words or such other vaccine as the minister may by order prescribe be deleted. Those in favor say aye. Aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is that Clause 3 be amended as follows, that after the word direction, the word or be deleted and replaced by the word and. Those in favor say aye. Aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is that Clause 3 now stand part of the bill. Those in favor say aye. Aye. Those against say no. I think the ayes have it. Clause 3 now stands part of the bill.
Clause 4.
Honorable Senators, the question is that Clause 4 now stand part of the bill.
Mr. Chairman, if you want to put 4, 5, 6, 7 and put them together and then put it through to us, no?
Unfortunately, we can't do that. We have to put each one as an amendment. Again, that's why we circulate amendments prior to starting this particular procedure. So we move forward. Honorable Senators, the question is that Clause 4 be amended as follows, that after the word vaccine, we remove the words or such other vaccine as the minister may by order prescribe. Those in favor say aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is that Clause 4 be amended as follows, that after the word direction, coming after 51C1, that the word or is being deleted and the word and is being added. Those in favor say aye. Aye. Those against say no. No. I think the noes have it. Honorable Senators, the question is that Clause 4 now stand part of the bill. Those in favor say aye. Aye. Those against say no. I think the ayes have it. Clause 4 now stands part of the bill.
Clause 5.
Honorable Senators, the question is that Clause 5 stand part of the bill.
Mr. Chair, I was so taken back with this, the first issue that we had. I had made a recommendation that a medical practitioner of at least 2 years' experience, and if I had missed it in Clause 2 to 4, let me try to put it in as a medical, in Clause 5, a medical practitioner of at least 2 years' experience. I am somebody to supervise, this is supervise, not giving a vaccine, it's supervising. And any one of us could come under that same issue. And we have a young intern just finished and is not fully accurate with resuscitation, and you end up dead. But a 2-year doctor.
So that, Mr. Chair, my understanding, and I am very certain about this, in your first year of this, you're calling about qualified medical interns. In their first year, they have to do courses and pass on resuscitation, on the use of medical equipment in an emergency situation, etc. So maybe 47 years ago it was different, but that certainly is what applies now and has been applying when both Dr. Brown and Dr. Ibrahim did their requisite qualifications.
Hold on. So,
an intern coming out to be a house officer and registered.
1 second. Let me just
Can't do anything.
Let me just make sure that everybody is on the same page and that we understand what is taking place here. This particular part of the proceedings is very specific and important. Senator Gopi Singh, there are 2 amendments that are being put forward now as we go through clause by clause, which has to happen by way of procedure. You are now requesting a 3rd amendment by way of a particular wording which you need to voice so that all senators hear exactly what it is that you're trying to amend and how it is you're proposing it is to be worded as it relates to Clause 5. Please voice such request.
Appreciate it, Mr. Chair. That is very kind of you to allow me. So, Clause 5, the Dental Profession Act is amended by inserting after Section 44 the following section. And we move to a dentist or a person who is temporarily registered to practice dentistry under Sections 15 and 16 of this Act, acting under the direction or supervision of a medical practitioner with at least 2 years' experience, may administer a 2019 novel coronavirus. And I'm saying this because here it is, you asking a dentist or somebody, a dental intern, to be supervised by a doctor who just finished internship. So,
So Senator Gopi Singh, no explanation is
Yeah.
required. AG, no response is required on that. I will put the amendment as put forward by Senator Gopi Singh after I put forward the amendment as proposed by everyone else. So, Honorable Senators, the question is that Clause 5 be amended as follows. After the words vaccine, the words or such other vaccine as the minister may by order prescribe be deleted. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 5 be amended as follows. After the words at 44A1, after the word direction, the word or be deleted and replaced with the word and after the word practitioner, the words with at least 2 years experience be added. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 5 now stand part of the bill. Those in favor say aye. Those against say no. I think the ayes have it. Clause 5 now stands part of the bill.
Clause 6.
Honorable Senators, the question is that Clause 6 now stands part of the bill. Honorable Senators, the question...
Chair, the same point
Same
I
thing,
made
same
under
thing.
5.
So we just process.
Right.
Honorable Senators, the question is that Clause 6 be amended as follows. At 13A1, after the word vaccine, the words or such other vaccines as the minister may by order prescribe be deleted. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 6 be amended as follows. That after the word direction, the word or be deleted and the word and be added. And after the word practitioner, the words with at least 2 years experience be added. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 6 now stand part of the bill. Go ahead. No, those in favor say aye. Clause 6 now stands part of the bill. Aye. Those against say no. I think the ayes have it. Clause 6 now stands part of the bill.
Clause 7.
Honorable Senators, the question is that Clause 7 now stands part of the bill. Honorable Senators, the question is that Clause 7 be amended as follows. At 28(1), after the word vaccine, the words or such other vaccine as the minister may by order prescribe be deleted. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 7 be amended as follows. At 28(1), after the word direction, the word or be deleted and the word and be inserted, and after the word practitioner, the words with at least 2 years experience be inserted. Those in favor say aye. Those against say no. I think the noes have it. Honorable Senators, the question is that Clause 7 now stand part of the bill. Those in favor say aye. Those against say no. I think the ayes have it. Clause 7 now stands part of the bill. Honorable Senators, the question is that the bill be now reported to the Senate. Those in favor say aye. Those against say no. I think the ayes have it. The bill will now be reported to the Senate. Acting Attorney General.
Thank you very much, Mr. Vice President. Mr. Vice President, I wish to report that the miscellaneous provisions 2019 Novel Coronavirus 2019 NCOV Vaccination Personnel Bill 2021 was considered in the Committee of the Whole and approved without amendments. I now beg to move that the Senate agree with the committee's report.
Honourable Senators, the question is that this Senate agree with the committee's report on the Miscellaneous Provisions 2019 Novel Coronavirus Vaccination Personnel Bill 2021. Those in favour say aye. Aye. Those against say no. I think the ayes have it. Acting Attorney General.
Mr. Vice President, I beg to move that a bill entitled An Act to Amend the Emergency Ambulance Services Emergency Medical Personnel Act, Chapter 2902, Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus 2019 NCOV vaccines under the direction and supervision of medical practitioners be now read a third time and passed.
Honourable Senators, the question is that a bill entitled An Act to Amend the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus vaccines under the direction and supervision of medical practitioners be now read a third time and passed. Those in favor say aye. Aye. Those against say no. I think the ayes have it.
A bill entitled An Act to Amend the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, the Pharmacy Board Act, Chapter 2952, the Nursing Personnel Act, Chapter 2953, the Dental Profession Act, Chapter 2954, the Veterinary Surgeons Registration Act, Chapter 6704, the Professions Related to Medicine Act, Chapter 9004, to authorize additional personnel to administer 2019 novel coronavirus 2019 NCOV vaccines under the direction and supervision of medical practitioners.
Leader of Government Business.
Thank you, Mr. Vice President, I beg to move that this House do now adjourn to Tuesday, November 23rd at 1:30 p.m. That is Private Members' Day, Mr. Vice President, and my understanding is that the intention is to proceed with motion number 7. Thank you.
Honourable Senators, before I put the question on the...
There is an order in which motions. He has no authority. I'm saying that the minister has no authority to tell you, as the Vice President, which motion shall be dealt with. There are 7 motions on the order paper. 1 is his, 2 is his, 7 is Senator Vieira. It has to go 1, 2, 3, 4, 5, and 6. You cannot come and tell this Parliament they shall go with 7. You're totally out of place and mad.
So, Senator Mark. Okay, members, members. Senator, Minister of Tourism, Senator Mark, Minister of Trade, I am speaking and I'm on my legs. Senator Mark, as far as I understand, there is an order. Senator Vieira has first bite of the cherry, so to speak, in relation to Private Members' Day. If the Leader of Government Business is indicating that it's motion number 7, I am going to assume as the presiding officer that Senator Vera is okay with that, and he has indicated to the Leader of Government Business that that is what he intends to do. Senator Mark, that's it. He has Senator Mark, take your seat. Members, I am on my legs. Let this chamber fall to silence. I have spoken. I have spoken, Senator Mark. Senator Mark, I'm not asking for debate. Do not respond to me. I have spoken. As the Vice President of this Senate, Senator Mark, I have spoken. If you wish to continue with these proceedings, you will. Senator Naked and Senator Mark, you cannot be speaking to me about procedure and then at the same time undermining that procedure as it relates to the standing orders and the authority of the chair. It will not be tolerated at no point in time of any proceedings. Senator Mark, I did not ask for a response. Senator Mark, take your seat. I am on my legs. I am not going to repeat it. Senator Mark, take your seat. Take your seat.
You have to be impartial. You have to be impartial. This is wrong what you are doing.
My classifying motion is an order. Yeah, they go first, second, third, fourth, fifth. I have to agree. You bypass me. Totally wrong. We are not in a dictatorship.
We're not accepting it. We are not accepting it. Show us how. We're not accepting it. This is wrong. This is wrong.
Never bypass voting. We have several motions there. You can't just bypass me. You're not.
Senator Mark, Senator Naked, Senator Leiter. Senator Mark, Honorable Senators, before I put the question on the adjournment, leave has been granted for two matters to be raised on the motion for the adjournment of the Senate. Senator Vera.
Thank you, Mr. Vice President. It has been said that the ongoing sixth mass extinction may be the most serious environmental threat to the persistence of civilization because it is irreversible. Already, thousands of populations of critically endangered animal species have been lost in our lifetime. This has been caused by humans, and it is accelerating. Of particular worry, since insects are a vital part of the circle of life food chain, is an international survey showing that the number of insect species have declined by 1/3 in the last 10 years. Global insect biomass is dropping by a rate of 2.5% a year, which is 8 times faster than the rate for mammals, birds, and other species. This is serious. Scientists are warning that at this rate, the world's insects can vanish within a century, threatening a catastrophic collapse of nature's ecosystems. In the past 3 months, on the 17th of August and 10th November, the Insect Vector Division has sprayed for mosquitoes in my area. Yet within days, the mosquitoes were back out in full force. The bigger problem, though, is that such spraying is killing good insects and beneficial pollinators. Researchers are warning about the potential for widespread environmental contamination and the need to curb the use of many insecticides. Now, I recognize that mosquitoes, besides being irritating, can spread diseases like dengue, Zika, and malaria. And there are often calls from members of the public for the Insect Vector Division to carry out spraying. But I also know that because of the mosquito's life cycle, spraying is not just ineffective, it's actually counterproductive. And that's not my lay opinion. Experts all agree that the benefits of mosquito spraying are short-lived at best. And ultimately, at the Forum on Pesticides in St. Louis, this is what the experts had to say. What do advocates of pesticide spraying say when confronted with the dangers of these chemicals? And the pat answer is, we do everything we can to reduce mosquitoes, but there are always some left, and you have to get them at sprays. Statements like these assume that pesticide sprays reach mosquitoes. But when virtually none of the spray makes it to mosquitoes, the argument has no merit. This is, in fact, the case. Spraying pesticides either has no long-term effect on mosquito populations or results in an increase in their numbers. Cornell University professor David Pimentel, after having reviewed published research on pesticide sprays, concluded that the average for all pesticides is that less than 0.1% reaches the target. Indeed, information presented so far demonstrates that mosquito spraying is a waste of time, money, and effort. It does not and cannot reduce the number of mosquitoes for more than a few days following spraying, if that. Ironically, besides deluding ourselves about the benefits of mosquito spraying, it turns out that spraying is associated with an increase in mosquito populations through the unintended but reckless killing of mosquito predators like dragonflies, ladybugs, fish, and several types of birds. Bats eat up to 1,000 mosquitoes a night, and dragonflies, the natural predator for mosquitoes, eats them at all stages of life. An individual dragonfly can eat hundreds of mosquitoes each day. But when we kill these beneficial animals and insects through indiscriminate and ineffective spraying, we are inadvertently helping mosquitoes. Many of these pesticides are toxic to fish, like guppies, who, unlike mosquitoes, don't replenish as quickly. When the natural predators of mosquitoes are killed as collateral damage, we enable the next generation of mosquitoes to come back in even greater numbers. It's also painful to consider the harm done to our pollinators like bees and butterflies. When bees and other pollinators like wasps and butterflies die, it puts a serious dent on our biodiversity. And it's also going to create problems for food security and our ability to grow certain crops, given that 87% of plants require pollinators to reproduce, and a third of our food crops require pollination. The variety of insect, plant, and animal life is capital we cannot afford to lose. They are key components of the web that supports us. When was the last time you saw ladybugs and fireflies? When the agricultural sector was reeling from the mealybug menace, we had to import ladybugs to deal with the problem. And today, you can't find the ladybugs. What we are routinely doing to these insects and animals is wrong. A wrong made worse by the fact that they're being killed in vain. In effect, just to give citizens a false sense of comfort. It has been said that the production of pesticides is part of a vast military-industrial complex that sees killing things as a basic problem-solving strategy. As it seeks to dominate and subdue nature, repeatedly brings disasters which dwarf the original problem. And this is leading to global warming. We have to be better stewards of the environment. Our insect populations are under siege, and if they go under, it will not be good news for humanity. It's time to stop the ineffective use of mosquito spraying. Protecting our biodiversity and combating climate change, now existential issues, must take priority. Global warming is an important factor to consider, as global warming is going to accelerate and intensify the mosquito problem. Any mosquito control program that ignores global warming will be an exercise in futility. If mosquito spraying is allowed to continue, matters will only get worse. Mosquitoes are going to breed more rapidly, they're going to become more active, and the pathogens inside mosquitoes are going to reproduce and mature at a more rapid rate. It is time to take stock. If we are serious about protecting public health, we need to urgently shift focus and direction. We cannot afford to underestimate the seriousness of this problem, because the misperception and misapplication of mosquito spraying does not take place in a silo. The negative effects don't occur in isolation. In his address to the global community at COP26, Prime Minister Rowley said that we must work for the survival of all species and not choose extinction. His commitment should not fall on deaf ears. By stopping the harmful practice of mosquito spraying, we will be taking a small but important step towards working for the survival of all species. I thank you.
Leader of Government Business.
Vice President. Mr. Vice President, may surprise you to know that I can agree with Senator Vieira while disagreeing with the motion. The ministry for which I have responsibility happens to sometimes come on the receiving end of spraying in relation to our bee population and generally the insect population. We sometimes suffer the effects of it when there is no notification to our beekeepers. But Mr. Vice President, it's a question of striking the appropriate balance. And if we look at the data, two things stand out. The first is that from 2014 to 2021, there were approximately 10,000 suspect cases of dengue, and I'm using dengue as one example. There were 10,000 suspect cases. And during that period, the confirmed deaths from dengue were just 4. During the period 2018 to 2021, the deaths were actually 0. And that had to do with the fact that suspected dengue cases moved from 5,517 in 2014 to 10 by June 2021. So I agree with Senator Vieira that spraying can have negative effects, particularly in relation to agriculture. But the use of spraying in Trinidad and Tobago is not new and has been very successful. The use of spraying is part of a regime from 1943 and led in 1965, by 1965, by the WHO declaring that Trinidad was malaria-free. The use of spraying is in accordance with the WHO guidelines, including the most recent guidelines of 2019, which calls for countries to use resources for the efficient, cost-effective, and sustainable vector control program. The Center for Disease Control recommends a combination of some traditional methods, removing the places where mosquitoes lay, destroying the mosquitoes before they can become dangerous, and third, killing the adult mosquitoes, which means, in most cases, spraying. I should point out, however, that Trinidad and Tobago has for several years not been using aerial spraying, recognizing the significant damage that could be caused, notwithstanding the benefits. So, Mr. Vice President, since 1943, Trinidad and Tobago has used different control measures, of which spraying is one, and non-chemical measures are the second ones, including cleaning, continuous inspections, education programs, monitoring, and penalties that are in place, and I must admit not always enforced, in relation to those owners of properties and those persons who do not take the appropriate measures to destroy the places where mosquitoes can breed and where mosquitoes can lay. So I close by saying the data has shown, particularly in the period 2014 to 2021, that while during the period years 2014, 15, and 16, the suspected dengue cases, to use one example, were significant, the recent data shows a significant reduction to the point that for the year 2021, up to June, there were just 10 suspected cases, and since 2018, we've not had a confirmed death as a result of mosquito-borne disease. Thank you very much.
Senator Mark.
Thank you, Mr. Vice President. Mr. Vice President, I've brought this motion dealing with the failure of the Minister of Finance to appoint 3 nominees to the board of the Customs Clerks and Customs Brokers Association, and the negative impact of said action on the operations of the said association. Mr. Vice President, for 10 long months, the Customs Brokers Board, the members of that board were not appointed. The Minister of Finance, who is conscious that under Section 1B of the Act, which is the Customs Brokers and Customs Clerks Act, that it reads, Mr. Vice President, there is hereby established the Customs Brokers Board, hereinafter called the Board, which shall consist of the Comptroller and 6 other members appointed by the Minister. And you have 3 persons nominated by the Minister and drawn respectively from the Department of Customs and Excise, the Federated Chambers of Industry and Commerce, and the Shipping Association. So the minister carried out that responsibility. When it came to be 3 members of the Customs Clerks and Customs Brokers Association, nominated by the association, the minister, Mr. Vice President, decided to inform these customs clerks and customs brokers, you see those appointees that you have sent? I don't like them. Withdraw them. The minister literally wanted to lecture and instruct the customs brokers and customs clerks as to who their nominees would be, Mr. Vice President. Now, what this essentially meant, Mr. Vice President, is that after several attempts to have their nominees accepted by the customs, by the minister, and every time it was submitted, the minister, through his permanent secretary, vetoed the appointments. Now, Mr. Vice President, the minister cannot, under the law, reject the nominees put forward by the association. This is law breaking. It's lawlessness on the part of the Minister of Finance. Where, Mr. Vice President, the law says only the association can nominate their members. The law does not provide for the minister to nominate the members of the board. We know where the minister comes in. I pointed out that to you a short while ago. So what I found very strange when this matter was drawn to my attention, I said, Mr. Vice President, what's going on here? And I have another motion coming up very shortly where the same thing was done with the trade union movement. But I'll deal with that when that time comes. So, Mr. Vice President, this Minister of Finance and this government believe that they can do whatever they want and whatever they like. But I want to let the minister know and this government know, you cannot do what you want. We will not facilitate you doing what you want. This is not a dictatorship, Mr. Vice President. So, Mr. Vice President, the minister knew I was bringing this today. So you know what he did? Hastily, he beated a retreat. And I understand recently he appointed or is about to appoint the 3 nominees. But for 10 months, the minister refused to appoint these nominees because he just refused to accept the nominees of the association. He must explain why. He must explain why he did that, Mr. Vice President. Mr. Vice President, as a result of him, that is the Minister of Finance, bluntly refusing to appoint these nominees, important matters relating to the proper functioning and advancement of that board became almost, well, actually, what a standstill. And this, Mr. Vice President, adversely impacted on the operations of the Shipping Association, the Chamber of Commerce, and of course the Customs and Excise, Customs Clerk and Brokers Association. Mr. Vice President, let me tell you some of the things that happened. Because of the fact that the minister refused for 10 long months to appoint the nominees to that association, exams that were normally held in April and October of each year were affected. The results of these exams not being held, of course, the board not being appointed, the board could not have dealt with those exams, and even the results of a previous exam that they would have set. And as a result of the minister's refusal, they could not even schedule new exams for this year. And there's an apprenticeship program that they also run, which was also undermined as a result of the minister's action, Mr. Vice President. And that employment opportunities went a-begging as a result of this. So, Mr. Vice President, this action by the Minister of Finance, which is inexcusable, indefensible, unacceptable, hampered the operations of this organization operations. And the minister owes an apology to the association, Customs Clerks and Customs Brokers Association for his action. But it's a pattern of conduct that we have witnessed that this government has undertaken because they believe they are living in maybe some other land. But I want to remind them, they're living in this land called Trinidad and Tobago. There's a sovereign democratic state, this state, and we have a constitution, and we are governed by the rule of law. This is not a dictatorship, and therefore we will not permit the Minister of Finance or any member of his government to deny citizens their rights in this country. And because he knew I was coming here today to discuss that, he ran hastily, the minister, and appointed the nominees because he knew what was coming. But Mr. Vice President, I want to give him a warning and the government that if they continue how they are going, they will pay a heavy price for that undermining of the rule of law and democracy in our country and violating the human rights of the citizens of this country. So we send a warning across the board that let them continue on this course and they will have to meet us, the UNC. We will confront them. We will deal with them. Thank you, Mr. Vice President.
Minister of Finance.
Thank you, Mr. Vice President. Long before the senator even contemplated filing this matter was addressed. The board is fully appointed. Thank you.
Senator Mark. Can I put the question, please? Senator Mark, there's no need. Honorable Senators, the question is that this Senate do now adjourn to Tuesday, November the 23rd, 2021 at 1:30 p.m. Those in favor say aye. Those against say no. I think the ayes have it. This Senate now stands adjourned to Tuesday, November the 23rd, 2021 at 1:30 p.m.